Welfare. Madam Secretary, would you please call the roll?
Chairman Mills.
Present.
Present. Vice Chair Barrow. Senator Boudreaux. Senator Carter. Senator Hinskins. Here. Present. Senator Luno. Here. Present. Senator McMath. Here. Present. Senator Mizell. Here. Present. Senator Pope. Present. 6 members present.
Thank you very much. And Senator Fessy, thank you for joining us. We appreciate you sacrificing your time to be here. Thank you very much. And you're part of the committee today, so make yourself at home. Thank you, sir. Thank you very much. For the audience and the members and everyone here, just to kind of lay out the format that we see for today's meeting, what we'll do is we'll allow all of the legislators an opportunity to address their concerns and the reasons that we're here, and basically the impact maybe in their districts. So I think they'd like to talk about that. We'll have an open dialogue between the department and the legislators during that phase of it. Then we'll turn it over to the department for any rebuttal, any comments, any action plans, any next steps. We'll go from there. And then the third phase will be, we'll also turn it over to the public for any comments that they may need. So if the public is here, you will get an opportunity to testify. And then the goal of this committee is, once we do identify next steps, action plans, we'll meet again. The president has assured us that he'll provide us those resources. We'll meet again just to see how follow-up is going, so that the public will know that between the department and this committee for oversight, we've got an action plan and next steps. Just to get the committee members up to speed, this document was prepared by the staff. It's a response that the department did send out to the Senate Health and Welfare Committee. A letter was drafted by myself, the Pro Tem, and Chairman Bagley, just addressing some issues, and it's all addressed from policies, procedures, and challenges that the department sees. And it also has a lot of good statistical information on how many employees are there, what the attrition rate is, and where we go from there. So to get things started, I'd like to call on the Pro Tem of the Senate, Senator Mizell, for your comments. And then any of the committee members, if you'd like to speak prior to anything else, just please indicate your light and have your light on, and then we'll go from there. Madam President Pro Tem, the floor is yours.
Thank you, Mr. Chairman. I just want to thank the chairman for and his staff for making this possible. I think it's really important that we have an opportunity to share the concerns that we've seen. I want to make it really clear. We were here 2 years ago, and we started a conversation. I think this picks up where that conversation left off. Some tragedies have happened that deserve a real heavy and thorough look at how we can do better with the children of our state. No matter how hard we try, they deserve that we do better. And I think this is an opportunity. It's difficult for people who have concerns about this to express those concerns, because there's no forum really available for those concerns to be expressed. I know many of my colleagues get emails, they get calls, and we want to take it a step further and see how we can put some action behind improving the outcomes for the children of our state. And if I could just say, I want to thank the department. I know that they are working hard, and I don't believe anybody doubts that they are working hard. I think that there's probably an opportunity now to look at things with some fresh eyes to improve the way we move forward. And I want to thank the chairman for the opportunity. Thank you, Mr. Chairman.
Thank you very much. Any other committee members? Senator Fessy?
Thank you, Mr. Chairman. One of the things I would like to bring up and get things answered on is what happened to Ezekiel in Terrebonne Parish a little while back. And so I got a bunch of questions on that, or where we missed the ball and how we missed the ball on saving lives. I was told that approximately in 2021, we had 55 children in the state of Louisiana die, in these situations, and now we're already up to 35 or plus in 2022, which is 20+% increase. And finding that it's related a lot to parents on drugs. And so I think we got a lot to accomplish in figuring out what we need to do in that relationship between parents on drugs and harming their children. So I'll have a lot of questions on that in the future, so we'll work in that direction. Thank you.
Thank you, Senator. Senator McMahon.
Thank you, Mr. Chairman. And again, thank you for putting this together. The reason that we're here is obviously frustrating and unfortunate. And it's not just one case or two. We've been seeing this. This is my third year in this position, and this is, I don't know, 3 or 4 of these that we've had either in session or out of session. I've been weighing, sort of what my position is going to be, just given the input that I've gotten, given the stories that have come across my desk, and taking into account like the political realities that we're facing, and trying to be as pragmatic as humanly possible. While I think there's been systemic failure, and I understand the reasons that have been given over the course of the 3 years at least that I've been here, and in terms of budget cuts and retention and just how difficult the job is in general. You're still in the position that you're in, Madam Secretary, and I'm still in the position that I'm in. And, children are dying. I don't think that there's going to be, again, going back to the pragmatic aspect of my thought process, a change that will solve the problem. And I think that a significant overhaul does need to take place. This was just given to me as we were sitting here, and I don't know if it came from you all or someone on this committee, while Alabama's child welfare system is among the nation's best, which is great. This is from 2014. It's 2022 now. So while I would be wholly in support of significant overhauls that have to come down from this administration, quite honestly, I don't see that happening over the next 18 months. So what can we do to try to keep the ship afloat between now and then? And that's what I want to hear from you all today. I want you to articulate some sort of wellness plan, or some sort of plan of action, because we can't lead or help you guys lead if we don't know what the plan is, and if in fact there is one. So that's, while I wish we were in a little bit of a different position here. I'm just trying to take into account, again, the political realities that nothing is really no major changes are going to take place between now and 18 months. I have a feeling that's going to be the case. So accepting that political reality, how can we listen to what the plan is and help you with that plan, so we stop losing lives and we stop having children that are raped by caregivers, because that's what's happening. So I look forward to listening to not only the input from the members of this committee, but from your department as well, and from the public. And I am probably going to be hitting the green button 1 or 2 more times, just so we can have a real conversation. And I appreciate the chairman's acknowledging that this is just the first of many, because we got to get to the next 18 months. So without losing lives. All right. With that, Mr. Chairman, thank you.
Thank you very much. And committee members, we want to make this a discussion where we go back and forth. So it's not like we're debating a bill. Let's have that discussion. Senator Carter, on that note, it's all yours.
Thank you, Mr. Chairman. I was looking at many of the materials that's in front of us, and one that struck me is the fiscal year-to-date performance, the authorized TO positions from fiscal year 2004 up until fiscal year 2023. And it's a drop of almost 1,500 authorized positions during that period of time. And I think if I'm looking at this chart correctly, I think there's a change in your fiscal year budget of 32% from fiscal year 2004 up until fiscal year 2023. I know that money doesn't solve all problems, but to the extent there's some fiscal issues going on that we need to fix with the budget, we need to know that and discuss it. It's my understanding that there's high turnover, there's problems retaining staff. If that can be addressed fiscally, those are the sorts of conversations that I think is very important to have, because if I'm looking at showing that your authorized positions back in 2004 was 5,325. And then we're looking at today a number of 3,634, and those are authorized positions. So that's not even dealing with whether or not there are any vacancies within that authorization. Just because you're authorized to have 3,634 doesn't mean you actually have that many employed. Just like but in 2004, you were authorized to have over 5,000 and money in the budget to accomplish that. So as we have this conversation, I certainly want to know, while the state has the resources that it has, how can we look at solving these problems from a fiscal standpoint, if that makes sense? Thank you, Mr. Chair.
Thank you very much. And you're laying a lot of the groundwork of the discussion, so that's great. Senator Luno?
Thank you, Mr. Chairman. You know, of course, there are several issues that we all want to discuss here, and one of those is one that Senator Carter just hit on a minute ago. Is I'm looking at the number of people you have and the budget you have and that sort. I chair labor, and so we deal with these issues all the time. We had one person that came to committee last year and said they didn't need a single person in their industry. Every job was full. Now, that was the only person I've ever heard say that in the last 3 to 4 years in the state of Louisiana. And from looking at this chart, it's pretty obvious that isn't the issue with you. So that is one of the things that I would like y'all to address, what effect the decrease in the number of employees has had, as well as the issues dealing with the budget, because we can see the roller coaster effect of the budgeting and what's happened since about, I guess, the 2010 session on forward. So that I would like for y'all to address that as well. And then finally, we compare ourselves to other states all the time. So I want you to compare us to other states and tell us where we're doing good things and where we're doing not so good things. And so I do, like Senator McMath said, I think we need to take an overall look at this, because I don't think there's a single problem. I think that there's lots of issues, lots of problems. Some of these things we couldn't avoid. Some things were avoidable, and we need to make sure that we have a fix in place for those as well. All right, thank you.
Senator McMath?
Yep. Sorry, I told you I'd be hitting the button a couple times. In the spirit of Senator Carter, lost me. There you go. In the spirit of what Senator Carter is referring to, and Senator Luno, if you had, when you have an opportunity to discuss this, if you have all of the money in the world, right, and you don't have any budget problems, in a perfect world, I want to hear what the plan, if you had that money today, what is the plan to, with all the resources that you could have, to address the child deaths, the unfortunate incidences of rape and abuse, how we can get foster parents engaged in the process again. Just in a perfect world, let's pretend that you've got all the money in the world. want to hear what that plan looks like today. Okay. And you can let us know how much that would cost too. But just, I mean, I'm really more interested in what the leadership, what we're going to do. What's the plan? Okay.
Very, very good. Representative Hughes for comment.
Good morning. Thank you, Mr. Chairman, first of all, for your graciousness in allowing me to join, and to the staff at DCFS. Good morning to you all. Madam Secretary, as you know, I've, over the past several weeks, expressed some pretty direct views about my opinion of the direction of DCFS. It's nothing personal. I want you to know that I like you personally. I will reiterate that, I feel you've been in position now for 7 years, and I do feel that there needs to be a new direction. I won't harp on that out of respect to the Senate today. But as we go throughout this hearing, I would like you to address, I keep hearing about the money issues, but what we're not talking about is the morale within the agency and why when people are hired, they don't stay. Over the past 3 weeks, I have gotten emails from current and former staff pouring their hearts out, asking me not to share these for fear of retaliation. And so, we can hire people, but if they're not treated well, that's a problem. We can hire people, we can say we have an open door policy, but if people are telling me that when they express their views, they're being retaliated against, that's an issue. And so if we can talk about the culture of fear and retaliation, and over the past 7 years, what has been done to prevent those things would be appreciated. Mr. Chairman, thank you for your leadership, and thank you to the members of the committee.
Thank you for being here, and this is going to be a wide open dialogue between the department and the legislators, so we'll continue that dialogue. Senator Hinchkins?
Thank you, Mr. Chairman. I appreciate it. Madam Secretary, thank you for coming today. There's a lot of issues on the table today, and this department has had a bunch of friends up here over the years. We've fought in appropriations to put money back for you over the years, many a times. But we question the leadership now. I mean, I've heard you say that work is complicated. It is. I heard you say, I hope no one's losing faith in the department. They are. And when they're losing faith in the department, it needs leadership to turn it around, not just saying I need another $10 million in the budget. That's what I want to hear today. What are you going to do in the next few months, in the next 18 months, to prove to us that leadership is there and capable of doing it? So thank you, Mr. Chairman.
Thank you very much. The President of the Senate has joined us, and I want to thank President Cortez for allowing us the opportunity to meet, the resources you help provide us for, and I know your goal is to make sure that we do the best work we can for the children of Louisiana. So we'd like to turn it over to you, President.
Thank you, Mr. Chairman. First of all, thank you for being here. This is not the first time that the Senate committee or the House committees have had to be convened for the purpose of carrying out their duties, their sworn duties of oversight of the executive branch agencies. Earlier this term, we had it on both sides. The House and the Senate convened committees for the same purpose, with the goal always to have the best agencies in the country. We want to be the gold standard in all of our agencies. This agency, I don't want to repeat what everyone said, but it's not missed by the public that this agency has failed and had missteps along the way. I'm one of the few people, along with Senator Pope and Senator Mills, that were here during the general administration. I believe Senator Pope may have been on appropriations with me at the time. And we recall a lot of the funding changes that occurred back then when technology was on the rise, and technology took over in large part for people because you didn't need a person to sit there and write an app when you could fill it out online and things of that nature. And so I'm sometimes a little bit dumbfounded when I hear that the agency doesn't have the resources, that the legislature didn't allocate the resources and the funding priorities, and so I'm concerned that can be somewhat misguided when we want to go back to, the planning and budgeting and request what the requests were from the agencies, because it's my understanding, and I want some clarity on this as we go forward, that over the years, since we served on appropriations, I don't recall that the legislature cut budgets that were recommended in the executive budget without a reasonable request and dialogue between the agency and the legislature. So with that, I have made the commitment to Senator Mills and to the chairman that this committee do everything in its power to find solutions. We're not here, this is not a witch hunt. This is here to find solutions to make the agency, like I said, one of the gold standards in the country. Much like we did with the conversations relative to state police earlier in this term. So with that, I appreciate the committee members being here, taking your time to be here and participate. And I know that many of you have been sitting and hearing these conversations. Those of you who are on the Health and Welfare Committee are hearing this on a regular basis, and your constituency has concerns, and hopefully they will be brought to the table today. So my commitment to you, Mr. Chairman, and to the members is that as many times as you need to meet and as much staff as you need dedicated to getting those answers, that they will be here. And so I appreciate you putting this together, and thank you all from the administration, from the agency, for being here today.
Thank you, Mr. President, and thank you for being here. Just a little house cleaning is Senator Barrow really, our vice chair, really wanted to be here. In fact, she called me during the weekend several times just to discuss kind of things she'd like brought up. One thing, she wanted civil service to be here. She wanted to hear some testimony from civil service. And for the vice chair not to be here, we wish her well, because it has to be killing her not to be at the committee hearing. I know she wanted to have this dialogue. As chair for Select Women and Children's, she had a good hearing that we started the process, we started the dialogue, and this continues it. Another committee member that asked me to put something in the record is Senator Boudreau. Senator Boudreau, as we speak, is in Rome, and he's going to have an opportunity to meet the Pope. So he's in a much better place today, I think, than us. But he'll be praying for us. But he did want me to put into the record, and I know the department, I know who this is, but he said he wanted to inform the committee members that Judge Tommy DePlanche and he have discussed the staffing and program issues in the Acadiana area. And I know so many of you know Judge DePlanche and his good work. He has pledged the resources in his office to assist DCFS in any way possible. So he wanted to put that on record and to let everybody know that. And I see so many of the staff members shaking their heads, knowing how Judge DePlanche really works well with everybody, and he's got a heart for children. Be it on that note, I do want, before we start the discussions, on behalf of the committee, I do want to thank every person that works at DCFS, that gets up hard every day, works hard, makes a difference, because we're in a tough environment for any occupation right now. The way COVID has dealt us a crazy hand, and the way that society has had to deal with the pressures of COVID in life, you have a tough job. And for the people that are working in that department, this is in no way to bash you or bash your morale or to bash any of the things you do. This is just an opportunity for us to be better. That's what this is for. And when you put collective minds that have the same goal, you reach those goals together. So what we're going to do is we'll start the working dialogue with the department, and we'll kind of take some notes, and hopefully we have an action plan. But I guess before you start the presentation, I did want the committee members to know that in this yellow-bound book, the first portion of the presentation basically is a response from the department, and we had a lot of questions that Senator Mizell and myself and Senator Bagley had Ms. Cannon put together, and the response is very detailed from the department. They bring out the policies, the procedures, the timelines. But one of the things, before we maybe get into a more formal presentation, I'd like the staff to maybe talk about from the department standpoint is, it looks like over the years, from the dismissal and the reasons for separation, A lot of it is for, a large percentage is personal reasons for resignation. A lot of it is for reasons not stated. If you just look at fiscal year 22 as of now, the reasons for pay are just 7.8%. So when you look at where the pay is, you look at the regional averages, you look at where things are, it looks like there is kind of been systemically, not just for 2022, but in 2021, the same thing you had. You had 34% of the staff resign for personal reasons, 15.1 resigned because of not stating those. In 2019, you had resignations for personal reasons at 49%. And just, can y'all address, just, let's start on that aspect, because what was brought out in the select committee was training is a very tedious process, and you know, when you can't retain staff, that becomes even more problematic. But can you address the reasons for resignation, the reasons for people leaving? Because I'm sure you must have an exit meeting of what was the reason you left. So can we maybe start addressing that, and then once we finish that, if there's no questions about a committee, then we'll turn it over for your more formal presentation.
All right. Good morning, everybody. Marquita Garner-Walters, Secretary of the Department of Children and Family Services. And I sincerely want to say thank you for this hearing. I truly believe that as the oversight committee of this agency, we should be in more constant dialogue, and that we should be meeting closely and more frequently. So let me say that. I will start, and then I will turn to Dr. Hodnett for specifics, but when we do our exit interviews, what we hear consistently over and over and over is, I don't have work-life balance. I go home late after having a long day, and I still feel the burden of my caseload when I go home. I neglect my family because I'm worried about the kids in my caseload. Excuse me, I can't get to everything I'm supposed to do, and that makes me nervous, anxious, scared, frightened, worried about my license as a social worker. I feel a burden that I can't let go of. And I don't know how to be more clear or succinct than that. When we are working people beyond their capacity to feel like they're doing good work, and that they are anxious because there aren't enough hands on the plow to do the good work that they're supposed to do, that they want to do, that they felt called to do, to come here. Because we are a mission-driven organization. People do come to this agency because they want to serve. They want to help people. They don't come for the pay. They don't come for the glory. They don't come for anything else. They come because they want to help people. And so they feel the burden. And when they don't feel like they're doing a good job, then they leave. And we hear that consistently over and over and over. One quick example, last week, one of our best managers left and took a job as a clerical worker for a construction company, cut in pay, and said, I just need to be able to go home and be with my family and not feel the burden of this work. I just need a break. So I'll let Dr. Hodnett go.
So on that note, what do you find, because it is systemic, the attrition rate, what are you finding out that may be that silver bullet where other states may be, because I know you share information with the other 49 states. I know y'all are all close as departments, but does somebody have the secret sauce in other states that have basically come up with a better balance, a better way of doing it? Because it looks like it's not just this year. It looks like it's systemic within the occupation.
It truly is. Child welfare across the nation is facing this. This is not a Louisiana-specific incident. If you talk to any child welfare system in the nation, they will tell you they are struggling with staffing. When we get deeper into this, we'll talk a little bit about when we saw this curve really shift was with COVID. But the child welfare system has always been one where staff felt a high level of confidence and assurance that they could do their job when there were enough people to do the job. And I will go back to what Senator Carter said. If you look at the number of staff that we have, and we can talk about how that happened and when that happened, and I go back to, and you've heard me say this before, this is not new information for you, but when I was the child welfare director in 2004 to 2008, when I sat in Dr. Hodnett's chair, I had 500 more people to do the work. 500 more people. It makes a big difference when there are enough people doing the work, that the work is spread evenly, and that the workers feel like they have control over their caseload. But when your caseload is 1.5 or 2 times what it should be because we don't have enough people, then you feel out of control with your caseload. You don't feel like you're managing your caseload. You're not getting to do everything that you know that you should be doing. And so you feel all the pressure that comes with knowing you're not performing at a peak level, and knowing that the difference in our agency when you don't perform your best is that horrible things happen.
Very good. Senator Mizell.
Thank you, Mr. Chairman. You and I have talked about this. So it gets down to the point where we've acknowledged we're way short. We're way short. It's a terrible situation. But what is being done in a very concrete way? As I said, I had a little preschool. Mm-hmm. We had to be a team. We had to uplift one another. Do you feel that's the environment that people have within? And I don't mean in the Baton Rouge office. I mean in the Bogalusa office, in the Covington office, where they're really at the grassroots level dealing with the ugliness every day. Do you feel that there is a team environment? Because I'm going to be really honest. I've gotten letters of resignation that were heartbreaking, where people felt committed spiritually to doing this as a mission, and they had to quit because the internal politics became more than they could tolerate, and they were heartbroken about it. So I know Dr. Hodnett and I had talked about, you see billboards for teachers from Dallas, Fort Worth. We all want more teachers, and there's ways to arrive at that. So one thing, are you building the team with who you've got, and are you have an active outreach to bring in people that would love to do this?
Yes, and I'll say a little more than I'll let Dr. Hodnett say it. In the strategies that we will present, because you're very clear that you want very specific strategies. Mm-hmm. And so we are working with civil service, we're working with the division, we are doing salary pay, civil, I can't think of the word, special entrance rates and all sorts of things to stabilize the salaries because they are low. So we are doing those things. Civil service has been very gracious and has worked with us, and we're going, I think, before the commission tomorrow to finalize some things. So we're doing the pay things that we think we need to do. We are looking at, to Senator McMath's question of how will we do it differently? How can we build it differently to meet the need where we are right now? And Dr. Hodnett can speak eloquently about the changes that we're making that we feel like maybe will help staff feel more supported and less afraid of the work. Specifically, Senator, to the point of morale. It literally, as an executive team, it breaks our heart when we hear about morale issues. I get those letters too, maybe not the same ones, but I get letters from staff. Every time that it is brought to our attention, we go to the region to try to figure out what's going on. Staff works with leadership in the region to figure out where the breaks are. Are supervisors being punitive because they're feeling pressure? Are managers feeling that pressure? I will tell you that right now in every region of the state, supervisors are carrying cases. So they're not able to do the supervision with their staff that they should do. And that puts them in a double bind because they're responsible for the case they're carrying, but they're also responsible for managing their staff. And then that means the manager, so your level is worker, supervisor, manager. That means that the manager is picking up the supervisory duties and probably carrying a couple of cases just to lighten the load of the people in their region. And so with our case counts where they are right now today, it is no surprise to me that morale is low because everybody's doing more than they should be doing and working outside of their job description. Because when you have supervisors and managers carrying cases, I mean, of course they're frustrated. So, but Dr. Hodnett, I'll let you.
Thank you. Rhonda Hodnett, Assistant Secretary for Child Welfare. So I'll be glad to tell you about some of the efforts that we have going on to recruit and retain. So we started with a plan to stabilize Baton Rouge, right? So we know that that was in crisis situation and there were some very specific things that we needed to do to stabilize Baton Rouge. But we had a longer range, more comprehensive and broader plan that really centers around 7 key strategies, and that's what we'd like to review with you all today. Many of these have been going on before, started before these incidents came up. Some have been expanded, and some are new since then to address specifically some of the issues that we've uncovered. So the first one really starts around recruiting, retaining, and supporting our staff and our foster caregivers. The Secretary said it very well. People are exhausted. They have no work-life balance, and it is not a surprise to me either when people say, I can't take this anymore, I've got to resign, and it's heartbreaking. You know, as someone who has been in this work for 35 years, I understand how difficult it is to feel like you're going to have to walk out of the door because you can't do it anymore. But it comes to a point where everything else in your life is suffering, and that's what I hear from people most of the time about why they're having to leave. So recruiting, retaining, and supporting staff and foster caregivers, everything from conducting job fairs, open houses, our partnership with the universities. So we are putting all of those things in higher gear than we have been. That we have a university partnership with 7 universities throughout the state that have schools of social work. And through that partnership, we have internships for students in social work. We also use that as an opportunity to send some of our employees back to school to get a master's degree. That's a partnership that the feds have some funding for, and it allows us to improve the competency level of the staff that we're bringing in. So in addition to that, because we have struggled in the past years, even though it's tuition that's being covered for them, we're struggling to get people into that program. And so we've extended it to some of the other universities that have similar programs like family and consumer sciences or other related things. So we're trying to reach out to all of the universities and work in partnership with them to get people in and to have internship opportunities so they get a sense of the work before they actually commit.
Has it worked? I mean, have you got a response from that that's made a difference, or?
We have gotten more people. We're still struggling to keep them. And I will tell you, I call people myself. That's the last group that we lost so many who say, I will pay it back because I can't do this work after they finish the internship. And I have called them, and what I hear is it is the amount, the sheer volume and liability and responsibility that goes along with the work. And with the sheer volume, I can't do this. That is the most common thing I heard.
So, and it's always going to be a tragic situation. This job is this is a rough position to be in. It's always going to be that way. Mm-hmm. So what?
So I'll tell you some
as you
things
say that,
I
I'm
think will
looking
help.
at 2017, the salary was $38,000. 2022, the salary is $48,000, and the attrition rate, the percentage of vacancies went from almost 5% in 2017 to almost 25% in 2022, when it's 10,000 more a year. Mm-hmm. So it's like we accept it's not the money. So to me, then you've got to totally rethink.
That's exactly right.
And have you all looked at what other states are doing where you have a different method of delivering the services
Yes.
altogether?
Yes.
Okay, what do you
Yes.
think about
so
that?
one of the key things that makes a difference is we're looking at 24/7 shifts. So I know Senator Jackson has brought this up. Others have brought up the idea of 24/7 shifts. Initially, we were thinking we cannot get enough people for the day shift, much less think we can cover night shift
Right.
and an overnight shift. But the more we have researched it, the more we've come to the conclusion that if we don't do that, we may be having to recruit a whole different group of people, but if we don't do that, we will never give people work-life balance. People have to know that they can stop at some point and leave. Right now, if you're working on a case, you just, at 5 o'clock, call somebody else to go see about your child from daycare or whatever else you had to do, because you cannot leave. And so having a schedule where you have an overlap piece during the day and people can hand off something in certain instances, or even scheduling your visits later, because most foster care visits will take place after school, so scheduling your hours later, working that later shift would be helpful. And then having an overnight and weekend shift, so an 8P to 8A and weekend. That is one thing that has helped in other places. And so we are working really hard to get something in place in New Orleans and Baton Rouge. We think those two places can easily justify it, and we think we can get a pool of people that we're hoping to get a pool of people that can fill that.
And you think that would serve a twofold? I mean, you would give a little ease to the people, but you would also, frankly, it sounds to me you would respond
Have better
better
coverage. Yes.
to a call that came
That's
in
right.
the middle of the night.
Yes.
Okay.
Another big thing that has made a difference is who is the team comprised of. So right now, you have caseworkers going out by themselves on a case, on investigations. They will call the police and ask them to come with them if it's they're going into an area that they're concerned about. And the police, while we have great relationships, they come when they can, but they have challenges themselves. And so oftentimes we end up having to go by ourselves. There are models, and again, Texas is one that has recently done this, and we've been working with them on it, where they have started hiring their own police officers, and they embed them into the child welfare teams. So they have retired law enforcement, they call them special investigators, and they are embedded into the team, and they go out with the caseworkers. The other piece that's needed to that is a medical component. The things that we are having to make decisions about on the spot, substance-exposed newborns, and just some of the other issues that we're seeing, requires a level of knowledge and competence that our staff just coming in don't yet have, and frankly, it could take it's a whole scope of work in and of itself. You know, I recently spoke with someone from LDH as we were working on some of the plans that they were helping us with around training, and I said, what do you help me think about the qualifications for someone going out to see the substance-exposed newborns and assess those? And she said, well, a nurse with neonatal experience and, you know, the whole 9 yards. We don't have that. And she acknowledged you're not going to get a team of those. So how do we get a handful of them and have them as part of a team that provides supervision to a much larger group? Because I can't go out on everyone. So we've had a very, very productive meeting with East Baton Rouge Sheriff's Office, and they are excited to try and partner with us in that effort. And the law enforcement that we would bring in does not take the place of them. So they don't go out with a gun and a badge. They are there really from a couple of different aspects. One is the detective mindset. So they are helping us understand some of what we're looking at, what we're looking for. They understand the drugs on the street and what our caseworkers might not recognize. They understand what information is available to law enforcement, and so they're able to liaison with the local office and get the kind of information that's needed. So it brings a whole different element to the team. That shared information, real-time shared information, is critical to us making better decisions.
And what time frame are you looking at of any of this?
Well, we actually, before the end of the month, we're going to see East Baton Rouge Sheriff's Office has talked to us about maybe being able to be housed, this team housed at the Family Justice Center over on Government Street. And so we're going to do a walkthrough with them and see if we can get something.
And that would be almost like a pilot program where you'd be
Yes.
using it in
Yes.
Baton Rouge first?
That would be, yes, that would be pilot for that full team. The other part, though, that is more doable everywhere is to have a multidisciplinary supervisory team. So as we talked about, the workforce has changed. We're getting people in for a short period of time. They're not staying in these jobs for 30 years anymore. And so how do we use the skill set of those who are coming in to our advantage? And so they care about people. They want to work in a people environment, but they're not staying long-term and not even staying long enough to where their experience is sufficient for the decisions that they're being asked to make right now. And so if we use them for their skill set of going out and gathering information, they're great at finding people. They're great at internet searches. They're great at being able to get information and let them bring that back to the team and have a team that is multidisciplinary. So law enforcement, medical, substance abuse counselors at the table, our social worker, obviously. That team can make much better decisions. And so that's it.
Thank you. Thank you, Mr. Chairman.
So on that same note, and I'm going to turn over to Senator Fessy, but on that same note, and I was going to bring that up later, but it seems like you're going to be doing almost like a contractual relationship with those departments to see if you can get that. So right now, you have 400 vacancies, is kind of what I'm hearing. Has there been any talk about a public-private partnership with, here's your policies, here's your procedures, an emergency contract would go out to, it's being done a lot in the United States. I mean, right now the federal government's doing a lot of that on the immigration issues. They're doing public-private partnerships with here's the deliverables, here's what you need. Many states did this during COVID-19. It's like we don't have enough people to man all the vaccinations and the screening, so a public-private partnership emergency contract was issued to fill those voids. So with your policies and procedures well-defined, the mission well-defined, have y'all looked into maybe that type of situation where you put out an emergency contract and you start filling some of those voids to take the workload off of your key people?
Mm-hmm. Yes, sir. We are in the contract writing right now in Baton Rouge with the Family Services of Baton Rouge to take the lower risk families, that they will take that body of work away from our staff. right now, if you think about the continuum of child welfare, you have the call center that takes, the centralized intake that takes the call, and then you have the investigation, and then for those children that we don't immediately put in foster care, that we want to stabilize them in their home, we have that bucket of work is called family services. So within the family services bucket, you have some families that are lower risk and then families that are higher risk. If Baton Rouge, if the Family Services Center can take that low risk bucket off of our work, then that gives us more manpower to shift to do the investigations where we desperately need help in Baton Rouge right now. I'm talking about stabilizing Baton Rouge. We are, they've already agreed. We've got, we're just writing up the contracts. And then with the higher risk families, we are going to be going for more court-ordered supervision, because what we've learned very clearly is that if a judge is saying, you're going to come stand before me and tell me how you're doing, we get better outcomes for children than if the court is not involved. Now, that means more work for our staff, because then there'll be those working those cases that will have to be going to court just like they do in foster care. But members, remember, the goal of child welfare is to stabilize families. Our job is to provide high quality child welfare services. That has always been a challenge. Even when you are fully staffed, child welfare is one of the most fragile buckets of work in state government. And when we started in this work, 6 years ago, when we walked in the door, we were determined to bring the best evidence-based practices into Louisiana. And you will remember, we did the Quality Parenting Initiative. We raised the age of foster care to 21 for those, because we knew that those youth, as they were aging out at 18, were falling off a cliff and weren't ready to face adulthood. We worked very closely with the feds. We worked with Chapin Hall, who is a huge research agency for child welfare, with the Child Welfare League of America, with Casey Family Programs, with many national organizations looking at what are the best practices. As to your question, what are the things that we compare to other states where they're doing good, and how do we follow that? Back a decade ago, Louisiana was the state that people came to see what we were doing in child welfare. But child welfare practice changes over time. And the pendulum swings from let's take every kid into foster care and have a lot of kids in foster care to removing a child is traumatic. Taking them away from their home is a trauma in itself. And when we started learning about ACEs, and trauma-informed practice, the pendulum the pendulum swung the other way. And it's let's stabilize families. Let's keep them together so that if we can keep them safe there, so that we don't traumatize the children and we don't tear up the family. And now we're trying to kind of find the middle ground between that. We don't want to swell foster care roles. That we don't want children raised in systems. We want children raised in families. We made significant progress. If you look at the little handout, the one-pager that we gave you, our turnover rate went from 23% when we walked in the door down to 13-something%. And then what happened? COVID hit the world, and resignations went off the charts. And all of you that are in business know this is not unique to child welfare or to Louisiana. This is true across the nation. We are looking at a new way of living with people that want flexible hours and working from home and more work-life balance and demanding more from their jobs that traditionally this body of work has never given people. And so we have to shift to meet this need. You're absolutely right. We have to figure out how to do things differently. That doesn't mean we were doing things badly before, that means the world changed. In 19, I'm really old, in 2020, when everything happened with our health care and our fear of being in congregate space and in what disease transmission looked like, the world turned upside down. How do you do a child abuse investigation when you are terrified that you're going to walk into a disease-ridden home and come out with something? Because you remember, in the beginning of COVID, we didn't know what we know now. We didn't have the resources that we have now. It was far less safe to do the work than it is now. And so we are trying to adjust and respond to all of that. The cases have gone back up because of the pandemic, and let's don't forget that 5 named storms hit our state last year, 3 major ones. That has an impact on our staff, just like it has an impact on the families that we serve. These are not excuses. These are the reality that we live within. And so, like systems all over the country, we find ourselves with an immediate need that we are trying to meet. We are, as Dr. Hodnett said, we're looking at the multidisciplinary teams, the night shift, the bringing on the police, not to be a policeman. Let me be clear about that. They're not going to be carrying a badge, and they're not going to have a gun. We're not taking armed people into homes as we do investigations. That's not what their role will be. Their role will be a liaison officer to the local police, will still be called to come out in those cases. But as Dr. Hodnett said, they can speak the language more cleanly between each other.
So, Madam Secretary, on that line of the public-private contract, it seems like with the shortage and what I've heard in select committee with women and children and the burden, because I think you did an excellent job of explaining if the 3 of you are caseworkers and all of a sudden you two resign, then the person in the middle has the 60 cases instead of the 20 cases. So as this continues to be systemic, as you're working on your new plan, what would be the downfall of having an emergency contract with a private provider saying that these are the deliverables we need over the next amount of time? Because it seems like you have to stop the bleeding, and it looks like these pilot projects are short-term. You're going to see if they work, but you have to have some deliverables, and it's happening in other states. I mean, they're doing it right now for monkeypox, for COVID, for immigration, oil field safety. It looks like these companies can respond to RFPs. Have y'all looked into this and seeing like it can be a 1-year contract, a 2-year contract, but it could be enough to just stop the bleeding?
Yes, if you don't mind. I'm Terry Ricks, Deputy Secretary of the Department. Thank you for that. And I did want to just put on the table that the entire department, leadership, not just child welfare, we're working all together with child welfare. Our plans are immediate, short-term, and long-term. And in each of those buckets, there are multiple efforts that we're taking, basically leaning out the process to determine what needs to be shored up at every part of the process. From the time someone walks in the door, for us, that means probably a phone call, right? That says that there's a child in need of care. From that decision all the way to putting that child back into their home, we're looking at the entire process. During that time, we're identifying opportunities for public-private partnerships, working with other state agencies, even using some of our staff a little differently to shore up some of the work that is needed in child welfare, for example. I'll give you one example of that is the consideration to contract out home development. That is one part of the work that we do that would free up 50 to 75 TO that would move to another area. These are people largely, there's some vacancies in there, but They're already trained, right? And so we would put them back into areas that would make sense for them to do more of the critical work right now. So that's an example of what you're saying. And then also with the security, we've worked with, and I want to make sure that you guys know that sort of kind of goes without saying, but I want to make sure that we say we're working with the commissioner, working with the governor's office, working with civil service to make sure that we have the ability to quickly pull on people in contracting circumstances, as well as even some critical hires that we would be able to catch immediately and move into positions for the critical work. So we're working on what is the child welfare, the entire schedule need to look like so that we can both hire well. And one of the things I wanted to make sure that you realize the difference in current pay, hiring pay, starting pay in 2022, that just happened. And so we don't really have all the outcomes from that yet, right? And so it's not exactly the same time period between, so we don't know how that's working yet. But we know that we have multiple inputs that we're working on. What helps an individual? What helps a team? What helps the entire, organization to develop? We're looking at the processes, determining where we can get in with contracts, like you said, and because we're looking for better outcomes. In the end, that's what we're looking at, better outcomes. So we want to be able to provide back to you as we continue these conversations. Okay, this is what we looked at. I'll give you another example, another contract that helped immediately. Workers are coming in, they're removing children, but they still have to deal with the paperwork and finding a home. So we contracted with a local child care provider where those children can be cared for by a licensed provider while the worker can do their work. It's simple, but it has been effective, and it's been helping. The workers would say it helps. The other thing that I would say, just wanted to bring up, is that we're also contracting out an EAP, a program for the workers to be able to get some help with the secondary trauma that they are going through from doing this work. We believe that that will also help the staff from our conversations with them. We have not only increased, it's hard to do exit interviews, by the way. Sometimes people go, this is it, I'm leaving, bye-bye. They don't really want to have a conversation with you. So we're doing stay interviews so we can understand from people who are in those seats how to keep them in those seats. And that's happening on both sides of the house. And then,
so not to cut you short, but there's a lot you're throwing at us that seems like it's really good stuff.
Mm-hmm.
Can you provide for Ms. Cannon and Ms. Peck exactly what your short-term, long-term goals are? Yeah. And each goal, what would it accomplish?
Yes,
would it fill 30 slots? Would it fill 50 slots? Would it help for short-term? Where we're at with training. Can you provide that for us?
Yes, sir.
Okay, because it's a lot coming at us at one time. So
Yes, sir.
I think that would help us to understand. But just to get to that point, and I'll open up some more questions, but get to that point is you've got some short-term, long-term plans. Some of it could be from outsourcing. Some of it could be from a team approach. That team approach would bring in law enforcement, medical disciplines, but as you projecting this, project what your outcome would look like.
Yes, sir.
If you could do that for us.
Absolutely. One other thing I want to just put on the table, since I have the mic for just a little bit, is what you guys have been bringing up with regard to how people feel at the job. And so I think this is a very courageous step on behalf of the secretary, right? The executive staff, we made a step to open up a diversity, equity, inclusion, and belonging council and an office. And so the council is made up of employees from around the state, all the different program areas, and we have a staff that is looking at various outcomes and outputs. What are we doing? What are people saying? And so we opened up an entire line of, if you don't feel like you can talk to, your manager for some reason, what is that? Why is that? So we opened up another line of communication through the Diversity, Equity, Inclusion, and Belonging Office. With the EAP and the DEIB is what we're calling, and the council, we've been able to pull in more information from the staff to help us understand what they are saying. And one person, I was actually at the council meeting, said, you guys just need to know that not everything that you're pushing down is getting all the way through, down to, to the all the way to everybody, right? So somewhere's in the middle, management maybe, there's a breakdown in certain spaces, offices, or programs. And so one tool that we've recently been using is basically called sort of an administrative office review, where if we're getting more than one or two comments that there's a problem in the office, then we send a staff of people who are especially trained to go in and ask more questions and understand what is going on in that particular office. One such administrative review recently yielded that there is a person really causing havoc, wreaking havoc in the office. And maybe the manager didn't know how to handle that. And so we saw the assessment is there is a problem here with leadership and training, and we need to change that. We need to address it, and we need to provide more supports. And so as we have gone through this process, we've learned, because when we walked in the door, we heard the same thing you guys are saying to us now. The morale is low. We got that in 2016. So we have taken multiple steps to open up the spigots and allowing staff to come and talk with us. We've increased the training that we have for everybody regarding things like biases, opening up opportunities for them to understand really what not just management is, but what leadership is. And the last thing I'll say is the example of that is a new program. It took us a couple of years to get this through because it is a curriculum. We had to go through the entire process of going through a curriculum. But 2 weeks ago, 12 supervisors and managers in child welfare graduated with a certificate from Grambling State University in leadership. And each of them would say that it was really a life-changing experience for them to be able to stop and focus on how I need to change as a leader and how I can influence others in the agency. That program really will help. Now you've got 12 people who took the time, their own time, but incentivized to become a better leader. And I think for too long, we had lots of managers who didn't get the training to actually become leaders. And we are trying to stem that tide as well and bring more leaders into the work. But another program that was a partnership with the universities. We have several partnerships with the universities. One of them is with LSU's Leadership and Human Resource Development. They are coming in to do an actual research project on the turnover to give us more evidence-based data to make decisions with. Thank you.
Once again, any of those initiatives, please provide that for us. Senator Fessy and Senator Cortez hit y'all button all at the same time, and in baseball, the tie goes to the president. Mr. President?
Thank you, Mr. Chairman. I won't be long, Senator Fessy. First of all, I want to thank you for acknowledging the challenges of the named storms, the hurricanes, the pandemic. Many of us, well, all of us here have staff members that work for us that how they're still around after the pandemic, and the amount of I'm going to say just verbal abuse they had to take at our district offices just because people wanted change and we couldn't affect change. We're the policymakers. The executive agencies actually do the work. It was very difficult on everybody. But I want to talk a little bit about some of the other areas where there have been challenges. Senator Pope and I have worked on some things relative to education and teachers. There's been a teacher shortage, but I happen to be reading a 1967 newspaper. It was the year I went to first grade. Guess what? Front page, teacher shortages. Teacher shortages are not new. They just happen to be in the news at at the time and we try to work on them. So what do we do there? We tried to cut some of the red tape in the teacher programs. We tried to give those students who wanted to become an educator an opportunity to make it just as easy to get that degree, and I don't mean easy in lowering standards, as it is to get an accounting degree or an engineering degree. Nurses. During the pandemic, every hospital told us they had a shortage of nurses. Nurses were quitting. They went and figured a way to hire and outsource traveling nurses. Teachers, they've been able to hire teachers, and they've been able to hire teachers since over the last 50-something years in shortage situations. I know that you have caseworkers and you have probably clerical workers. You mentioned a number of the difference. You have medical component. You have the law enforcement component. And I guess, the questions, and these are somewhat, I'm asking these questions not necessarily for an answer because I think you're all going to know, but for the public at large, what is the educational requirement? What is the certification requirement of the different types of people you have to hire? What's the training requirement? How long does it take? One of the things we all participated in passing was something called the Foster Promise Program, which trains people that are out in a job to get a certification or a degree to improve themselves, and it's based on what employers need. In many cases it's EMTs and LPNs and RNs and things like that. So I guess from a structural perspective, and you talk about them getting overwhelmed with the amount of work they have to do, has there been any thought of looking into, okay, I could hire somebody that's more entry level to deal with this, and I could get him in the door, and I could train him relatively quickly and take the burden off of, and Senator Mills used the three of you are the caseworkers and the two of you leave, and now everything's on you. But could we get someone in there to take some of that burden? And I guess the most discouraging part, and again, this is from the policy-making side, we're on this side of the dais, is that if you have 400 unfilled TOs, then why are they unfilled? If some of these things could be done, why are they not being filled somehow, some way, to relieve the burden on the person in the middle who's left there carrying the whole weight? So that's my question from a sort of global 30,000-foot view. If we know the problems and we know that there can be solved, then why aren't we solving them? Why aren't we getting people in the doors?
Well, I can start, and just want to say that you're right, and we have tackled them before, and now they are arising with a greater need. And so we will tackle it again, and some of the things that we've been talking about to be able to handle them, we are. And Senator Cortez, we do have a lower level position where someone can walk in with almost like basket weaving, right? And we can then teach them and train them and move them up through the series. We don't yet have a special entry rate for that person yet. That position is starting at 27 is hard. It's hard, 27,000 a year, so that one's hard to pull in. So our current conversations will hopefully yield exactly what we both want, and that is sitting with civil service and the commissioner, and then also doing some very specific and targeted outreach. And so one of the things that's probably one of the more promising things, again, as we talked about leaning out the process, is how do we get someone that we just met that looks like a right hire for us, hired more quickly and take some of the steps out of the way. We've identified that as one of the issues. Civil service identified that as one of the issues. And so we're happy to be planning right now some events that will allow civil service to be at the table with us, so that normally would take several weeks to process what happened immediately, so that civil services part in this is to determine that someone is actually qualified, which is, a defined term, which normally takes some back and forth, but doing some things with them. This happened also with LDH and also with OJJ and some other junctures that we can learn from, and so we are scheduling those to happen in September.
So one of the being in business, there was a popular book a number of years ago called Good to Great, and it was really one part of that I took from it relative to my business was, did you take the bus? Yeah.
Bus, yeah.
So get the right people on the bus, and then as you're traveling, figure out what seat to put them in. And so I'm thinking this through and extrapolating it in your particular world is, you might bring someone in that's clerical on day one, but in 2 years they may be degreed in doing casework because they're passionate about it, and you got to get those people. And again, I keep talking about Senator Pope and I, but we both are former educators.
Yeah.
You find me somebody who wants to teach school, and I'll hire them. And look, I taught school for a number of years, not as long as he did, but you don't want me back in the classroom. I mean, I'm 61 years old. I was passionate about it, and I still love kids, but I don't know that I could relate to them today like I could have a number of years ago. And my point is that if you get people in the door, the right people in the door, get them in the bus,
Yes.
and then figure out where they can help your organization. And I know you're working on that, and I appreciate that. The last thing before I let Senator Facey take over is that many times we get, we need to have legislative solutions. And obviously we're a long way from going back into session. But to the extent that we can help from a legislative statutory, if you have a statutory hurdle in front of you, that we can remove a barrier that we can remove. And I know you're working, with the other agencies that you need to work with. That's what we're here for. And again, that's why this dialogue is probably long overdue. But anyway, thank you for that. And thank you, Mr. Chairman, for allowing.
Thank you, Mr. President. Thank you for being here. Senator Fessy, it's your turn.
Thank you, Mr. Chairman. I guess where I'm going to start is, I want to tell y'all, I know y'all job is very, very difficult and trying to figure out all the challenges such as hurricanes and COVID and everything we've been through. But one of the things of being in business pretty much all my life, I had to learn that we can have too many layers of management. And when you made a comment a while ago that some of the stuff is not trickling all the way down, so from the caseworker all the way to the top, how many layers of management do y'all have?
We're counting on our hands here.
So there are caseworkers,
Mm-hmm.
they have a supervisor, and there's a manager. So that's a unit that they work
Okay.
in. There is an area director who is over the entire region, and then there is a regional administrator that is over 3 regions. The reason we did that is because trying to standardize and make sure that there is high-quality, consistent practice across 3 regions was the most we felt like we could stretch them and still make sure that we achieved that. And so at one point, in the previous administration, there was only one person who was over the entire state. And it was just unmanageable to be able to get consistency across regions. Now we have divided it into 3 tri-regions, and there is one person over each of those tri-regions. So it's that one person on the tri-regions. There is one person for each regional office, and then managers and supervisors.
So we're looking at 5 to 6 layers of management by the time we get all the way to the secretary?
That would be right.
Okay. A number of corporations found that as the major failure because it wasn't getting down to the worker. And I don't know if Representative Hughes is kind of feeling or getting the word that I heard, but listening to him. And because I'm hearing we got a toxic atmosphere in the worker down at the lower levels. And so if that atmosphere doesn't trickle up to the top, so y'all know how to fix it, that's where we gotta learn how to fix that problem. working in my business as when I was up to 600 employees, there's no way I could know everything's going on. But I had to have the right people in place to make sure I found out what was wrong. And here, the person that's really doing the work is just being kind of, I felt kind of not getting everything they need, and we're overworking them. And so, I'm hearing all these different numbers of how many cases they handling. We really need to get down to the worker and make sure we salvage those, because I look at the turnover rate cost in 12 months to DCFS is about $24 million a year. I mean, if we could just cut that in half, the $12 million, the money is in the system. It's just not being utilized in the proper way. And I know I'm not telling y'all doing y'all job wrong, but we just got to figure out how to fix it. So so the other questions I got is what is the number of managers we have versus actual case workers?
A 5-to-1 ratio.
So you got 5 case workers.
5 workers to a supervisor.
To supervise. But then if you go up the level, it's almost, if you go up 5 levels, you're almost 5 to 5. if you follow what I'm saying. I mean, in that particular one unit. So I'm just looking at that. What can we do to get the worker in a better atmosphere? Like President Cortez said, it's always about getting the person in the right seat on the bus. We can pile them in on the bus, but getting them on the right seat. So to get rid of this lower atmosphere until we fix that problem, and a lot of the things you say you got going on and that y'all putting together, putting a police officer, a retired police officer in situations such as what happened with Ezekiel. I mean, I watched a couple of videos of the neighbors recording when the police officers went out there, and it's chilling that if just a caseworker would have went out there, it would have been scary. So if that's the part of the toxicity that they're talking about, because they're having to go to parents' homes that they get called on, and there's drugs and everything else going on, that's a scary situation. So I think we really need to look hard on how we're going to help that worker so we don't have that toxicity at that level. And I just see all kind of things that we need to fix when it comes to that lower level, to make sure they have all the tools in their box. As me running a business, if I send my crew in the field and they don't have the right tools, we're going to fail every time. And I think that's what's happening. We got to quit failing. So I just wanted to get that out there, that, talking to people that work in the field, it's, we got to get that atmosphere better. And if we don't fix it, we really doomed, because when they all, we got to get them to let them know that we want to back them 100%. And if y'all got any response to any of that, I'd appreciate it. Thank you.
Thank you, Senator Fessy, so much, and thank you for your support of your region. I know that our staff really appreciate you there and know you and know your name, and you know their name, and that's important to them. And I think many of the things that Dr. Hodnett and Terry have said are exactly aimed at that, having those administrative reviews in the offices to find out what's truly going on and where there's a toxic environment, having the ability to wrap the workers that have these high caseloads until we can get them down, because we will get them down, but until we can, to wrap them with the support they need to give them the tools to do the job. They need that medical advisor. They may need that law enforcement type presence. They need an on-call supervisor. Another thing that Dr. Hodnett brought to us from another state, when you were talking about when we look at states and where we see things that are doing well. We've pulled a model from the state of Idaho that's, I won't remember what it stands for, but CCDM, but basically it's an on-call supervisor, so that if your supervisor happens to be carrying a case and you can't get to them right away, this is a supervisor that is on call, and you get an immediate feedback. You get the immediate support that you need. And then while you're talking to them, they're doing the data entry about the case, to Senator Cortez's point about having people that can do some of the work that bogs down the worker. So they're actually putting the data into the record while they're working with the worker. This is new for us. We started this,
7 months ago.
6 or 7 months ago, and it's showing great promise. We haven't rolled it out across the entire state. Dr. Hodnett will have to tell me exactly where it is, but we are in constant contact with our colleagues around the nation, and we are always looking for best practice and what other people are doing. Senator Mizell, you're very familiar with working with Texas for the human trafficking issues and trying to figure that out. So
as you implement those pilot programs from the other states, can y'all keep us posted on that? Because I think that helps both the committee, and it helps all of us to understand what's going on. And on that same note, do you have the technology that can integrate to make the system work as Idaho? Because usually when you come up with something new, you have to have the technology that it talks to everybody in the region, and it basically helps communicate better.
Right. So as
Excuse me, Senator, let me put...
And I got another thing to add is that the talking to the police officers and stuff, when they have to call into DCFS, it takes them, they're saying anywhere from 30 minutes to an hour to go through all the questions, and they don't have a lot of those answers because they're kind of in the blind of what's going on too. So what can we do? You know, like you're saying, if we get these assistants to go out, what can we do to save the officers time? Because they got a lot of other things to go do besides answer, a questionnaire. And talking to officers that were, going through some of these situations, I think we got to come up with something better, a way of doing that also, because they don't have the time with all the calls they have. They're overworked too. So we got to come up with something that it may be a 15-minute questionnaire or something that gets down to the nitty-gritty, and so then we can all make a decision and make sure we can cover everything. So that was something else, I had on my list that we needed to discuss.
When we met with the Baton Rouge sheriff last week, and he brought his entire team, and it was a really great meeting, that was one of their issues as well, that when we shifted we used to have every region had its own hotline number, and so when you called to report child abuse in Bogalusa, you would get something different than you might get in Shreveport or New Orleans. And so when the idea of centralized intake came in, it was to standardize the practice across the field. That's a good thing. One of the drawbacks of it is that you lose the local connectivity of, I know the staff in the region and I can pick up the phone and call this worker and tell her that I've got a bad case and I need you to come. And so we're trying to figure out what the best model is to keep our standardized, centralized intake process and still have a quicker connection between law enforcement, hospital, and on-the-ground workers, because that personal connection is really important. One of the things that we learned is, it's one of these, two sides to every coin. So if the local law enforcement says, I know that family, I know what's going on in that house, there's no need for you to come, that's good to have local knowledge. But on the other hand, to that, there might be a bias to that. And so you might not be making the best decision because of those biases. So we're trying to dance that dance of figuring out exactly what the right connection is. In Baton Rouge, where they have the Justice Center and we can be embedded with them, I think that'll really solve that problem. In smaller communities where there is no such organization or physical plant to do that, we're going to have to figure out what that is. Do we make that direct connection between the local manager and law enforcement so they don't have to go through the process? We've got to get the information that we get at intake. That's critical. We've got to know that. We've got to document it. We've got to be able to prove what we heard, how we heard it, when we heard it. Because if we don't, then you're going to come back to us and say, well, how do you know that case was called in? How do you know that that report was made? There's no documentation for it. If I can just pick up the phone and call the worker and the worker comes. So it's a complicated system to figure out, but we're working on it.
Okay, so, because my thing is maybe you can break it down, or the police officer only has to do this, and then it falls to the next one, and then that way, because some of them said they just not even going to call in. You know, they don't have the time, and so that creates even a worse problem. So I'm just, you know, trying to get it out in the open. So we, you know, I'm here. Need any ideas? We're all here, sitting here. We just want to fix it. We want to help.
Yes, sir. And we appreciate that sincerely.
Thank you, Senator Fessy. Senator Luno?
Thank you, Mr. Chairman. Madam Secretary, I had a conversation with one of those first-level supervisors that supervised five, or I was thinking it was 6 people when we talked, but maybe it was 5. In any event, they were having some issues in a case I was involved in, and I talked to them about what was going on. And she said, well, we had a person that had been here a long time, but they retired, and we couldn't find anybody else to hire, so we divided up her caseload among others, and that created more problems for them. And there was an uptick in violence across the state, which created more problems for them. And she said, these people just burn out really quickly, and sometimes they quit that way. The reason I tell you about that conversation was that occurred in 1993. Those problems never go away. They come in cycles, and we're back in one of those cycles. Unfortunately, we weren't prepared for some of those things that came down because of a multitude of reasons. And some of those reasons include COVID. You know, COVID was difficult for everybody, and it made your problems in your department exponentially hard. And when we have those things to deal with like that, we look to you and say, well, if it were a business, we'd do this. Well, it's not a business. Kids of the state are not a business. Can we learn some things from business about how we do it? Yes. I don't think it's unreasonable for an organization statewide to have the level of supervision or managers that you have, because the 5 people that are under that one supervisor, they aren't directly supervised by those other people. They look over the whole project statewide, and that's similar to what a business would do that's statewide, that has a presence in every parish in the state. So I don't know that that's an issue for us. I think one of the biggest issues you have, and that we have to figure out a way to address it, is staffing. Because I did have 2 people recently contact me. Both of them had quit the agency, and fortunately I was able to speak with one of them, and he told me that his biggest problem was that caseload piled up, and there kept promises being, we're going to hire other people, and we're going to get your caseload down. It never happened, and so I think that's a huge problem that we have. So what I want to know is, what can we do to help you with that? Is there something we can do, a short-term or a long-term fix, through civil service, through the rules that you have to work under? Can we continue to do oversight committees where we bring specific agencies in here and ask them why they're not cooperating with you or doing what they can to help with this problem? Because this is the old, I think it was Hillary Clinton said, it takes a village. Takes a village. This is what it takes. You got to have somebody in all these different areas. What can we do to help you?
Thank you so much for that question. I think one of the first things you can do to help us is to help us recruit, to talk about this work positively, and to help us find the people. It's hard to recruit when all people are hearing are negative things. And that may sound, I mean that sincerely, because we are struggling to get people in the door, and we clearly have to get more people in the door. We're going to shift resources internally to meet the need. That's what we've been doing in Baton Rouge, because and we keep coming back to Baton Rouge, members, because Baton Rouge is the region that, and I use the term on fire. Baton Rouge is on fire right now. It was New Orleans 4 weeks ago, or well, not that long, 6 months ago. And it rotates, and it could be anywhere next. I remember just a few, right as COVID started, it was the Alexandria region that was the region that was struggling the most. I don't know what drives those ebbs and ties, but because Baton Rouge is on fire, we have literally emptied out the state office to put people in Baton Rouge working there to carry cases and to pick up managerial duties so that.
Let me interrupt you a second and ask you this. As far as pay and starting pay coming in, I saw something the other day that amazed me. I stopped by a fast food restaurant, and I walked up, and there was a sign on the door, and it said, hiring, starting pay, $20 an hour, burger joint. You know, can you compete with that?
We had a really hard time competing in New Orleans when McDonald's was doing a $10,000 signing bonus during COVID. So we are working very closely with civil service. We did get the special entrance rate that started in January. And so it's been in place now 9 months. They're doing what we're going to be talking to the commission tomorrow about are some other things that civil service has done with them that has given us interim approval to do some additional pay on top of that.
So one thing I was going to suggest to you is when you talk to them, we don't want anybody's hands to be tied. If there's something we need to do to put that in place, to authorize civil service or authorize the department, whatever it is, to do some short-term measures, come to us and let's do those in the interim. This committee could help you to do something like that. So that would be something that's important.
And Jamie, civil service is here if you would like to talk to them, because that was something that was important to our vice chair. She wanted civil service here for the committee. So we do have a representative here if you would like to talk to them.
Okay. I'll do that.
Didn't mean to cut you short.
That's okay. Just a few other things, but I would like to talk to civil service about that. One of the other areas I wanted to ask you about is COVID. Mm-hmm. How are we now with COVID as far as it directly affects the department? Are things getting better with that situation? I know we've had a spike in COVID again, but is that better?
We track that every day. We've had 786 cases so far this year. And that's just in DCFS. You know, across the state, I think the COVID numbers are pretty scary. I mean, we're up over 2,700-ish, and we've had at least a dozen deaths in the state.
Were the deaths, are you talking about deaths of children or deaths of
COVID, just
COVID-related deaths?
Yes, COVID-related deaths. So there is an uptick. We are tracking it. In fact, one of our Renda's deputy that would have been here, that's our policy expert that would have been here today, is home with COVID. And so, yes, we are definitely seeing there was a big spike in the summer months.
Okay. One of the issues that I think we're seeing dealing with children's issues in every level across the state is the increase in violence from the parents, and not only the parents, but often the children. We've been dealing with a whole lot of that. Is that something that affects your department? And if so, what can we do to help you there?
That is one of the things, if you look at the graphs on the back of the one-pager that we gave you, the homicides in Baton Rouge, if you just look at that from 19 to 21, from 97 to 170. The drug overdoses, the drug-exposed newborns. So you may not all realize that when a baby is born to a substance-using mother, that's considered a substance-exposed newborn, we are required by law to see that child. That caseload has skyrocketed, and we have not kept up with the number of staff to meet that caseload. We live inside this work. Homicides, drugs, gun violence, the number of children in that number that Senator Fessy mentioned about the child deaths so far, the number of children that we have seen this year killed by playing with a gun is terrifying. And to think of the worker that had to take that case, how do you ever unsee that? And so, yes, sir, we live in the middle of this trauma, and this trauma is affecting our work, our workers, and our caseload.
I had lunch with the sheriff of Rapides Parish last week, and I have to brag on them. They made a bust, and they seized enough fentanyl to kill every person in Rapides Parish. Every person in Rapides Parish. One bust. So it is a problem that we're going to continue to face, and I wish I had answers for you, but I don't. We gave you some more money in the budget this past year to try to fill some of these voids. I know that that's not the cure-all to this. I just believe in my heart that, not saying you don't need more funds is because of the things that we've been talking about, but I don't think that's going to be the cure for the problem. What I would like, and I know this is going to be a difficult question, and I'm not expecting you to give me all the answers today, but one of the things I would like you to come back to us with is some kind of systematic approach to it. And it's a moving target all the time. I understand that too. But tell us, come back and say, okay, in this issue, here's where we need help, and this is what you can do to help us. And whether it's funding or whether it's hiring, whether it's getting more people trained through the technical and community college system, which I'm a big believer in, whatever we need to do to help with that. Because this problem is not going to go away. Like I told you, I've had this same conversation, Mr. President, in 1993 when I was a young lawyer appointed to a case to represent a juvenile. And it's going to be an ongoing problem. It's going to come time. And you can't staff up for every one of these things. We realize that. But when we know that there are some problems that have to be addressed. Let us help you.
Thank you so much.
Thank you.
Senator Luna, just to answer your question about the $20, our incoming child welfare trainee with the special entry rates and all would be $17.55 an hour.
That's a little bit more stressful than working in a fast food restaurant, and that's the level of pay we're at. And look, it's difficult. I don't know I'm not nearly smart enough to have the answers to how we address that, but that's obviously a problem we're going to have to address.
Thank you, sir.
Thank you.
Thank you for the questioning. Madam Pro Tem?
Thank you, Mr. Chairman. I want to shift it a little bit. The reason the chairman and I spoke and started the conversation on this was the loss of life of children that were successive weeks. And we can talk about vacancies all day long, but in my mind, what I have not been able to answer is how a call to call intake was not answered. I understand we're 400 short. I get all that. But at the very heart of, I think, what we're all here about is I want to better understand when the hotline gets a call, and I know on your one-pager you mentioned you've made changes in centralized intake. And, on the other answer to the questions, I see that there is the grading priority 1, 2, 3, 4. I want to understand what appeared to me to be what would be a priority 1 call coming from the hospital consecutively. What happened? And tell me how that's never going to happen again. So kind of.
Can I add to your question if you can? Because I did get to hear this in select committee when you went over from priority 1, 2, 3, 4 and what the action steps need to take place. That was where I was going to go. So I was going to basically say, as you answer the pro tem's questions, let's just talk about priority 1, because the definition of priority 1 says the first face-to-face contact with an alleged child victims shall be made as soon as possible, but it must be within 24 hours of receipt of the report by the agency. The first face-to-face contact with at least one of the parents' caretakers shall also be within 24 hours. So talk about that. Talk about the questions that the pro tem, but also talk about the success rates of hitting the 24 hours.
So to your specific question about how could it go unanswered, the initial information on the initial call, the first call that you're referring to, had some information that questioned the urgency of the response. And when you say, how could it not have been, I understand in hindsight looking at that and saying that. But there was a negative drug screen. There was no belief that it was necessary to call law enforcement. There were multiple things that there was a plausible explanation by the mother. There was no prior history. So there were multiple things that went into the decision on that first call. In hindsight, of course, we wish any risk
Right.
we would have responded to. The second call was accepted, and the worker did go out, but was not, the mom was not home, was not able to make contact initially, made a phone call, was able to connect with her by phone and set up a time that she was supposed to go back and meet with her. Got another call, ended up having to go out on, taking custody, staying into the night, which carried over to another case that stayed into the night. And she just she did not get back out there quickly enough.
So let me ask you, when that call is made, is the caller, anytime the call is made, outside of that actual event, is the caller given some number or something that verifies,
Yes.
okay, this information has been passed on?
Yes.
The caller is given a verification of some kind
Yes.
that the call was made?
Yes.
Okay. And is there a follow-up? I asked this in Senate Select Committee like a year ago of the young lady that does the call intake. And her response was, no, is there a follow-up? And can I have some peace of mind when I take a call, if I'm your call intake person, that somebody's following up on what I just heard on my line? Because, if I'm hearing the trauma of whoever's calling to tell me that, and all I'm doing is passing it off, to me, it would be really frustrating not to know that action wasn't being taken on that situation. So is there a follow-through in the process that somebody knows that action's been taken on that?
So let me make sure I understand your question. So the intake worker takes the information.
Right.
Makes a preliminary recommendation, disposition, sends it to a supervisor. A supervisor validates the preliminary disposition. If, regardless of whether it's accepted or not accepted, it goes to the local office. And so the local office gets them. If it was not accepted,
At what point is it not accepted? Who in that chain does
the supervisor of intake.
That's when it's found not to be valid.
No,
Oh,
no,
okay,
there's a
what-
difference in those
okay,
terms.
okay, tell me
It's not
that.
accepted. Validity comes into play when you actually do the investigation and determine whether or not abuse or neglect, there's enough evidence to say that abuse or neglect has occurred.
Okay,
That's the
okay.
validity part
Okay,
of the
okay.
investigation. This is at the intake part. So it is determined that it meets the criteria. There is a caretaker that meets our
Right.
definition. There's a child, and it meets the elements of abuse or neglect, as in state law. And if that is if it does, it's accepted, it's assigned a priority, and it's sent to the local office. There's a person in the local office that's responsible for monitoring this queue and going through the intakes and assigning them to caseworkers in the local office. They're also responsible for looking at all of the cases that are not accepted to be a second layer of review and making sure that there's agreement with that. If they do not agree, if they think that the case should have been accepted and it wasn't, they will send it back up and say, reconsider this. We believe this should have been accepted. Maybe they know something about the family. Maybe there's something that they know, or just another layer of oversight to say, you know, I got your back. Let's rethink this. I think maybe you missed something here, and they send it back. So that is another layer of oversight there. And then the worker goes out on the investigation from that
And all
point.
that would happen, is it set as a priority 1 at that point yet? Or are you
It's
still
set.
trying to decide if it's a 1 or 2 or 3?
The intake worker, and when the supervisor
She takes
verifies
the
it,
information
they
on the
make
call, she
decision.
determines a 1, 2, or 3.
Yes,
And then it's decided where it goes from that point.
yes.
So in the, I see Senator Fazy's gone, but in the situation where the neighbor called with Ezekiel, that was what the news story said, that the neighbors had called. You don't have any
Do
record?
not have any evidence of receiving a report from a neighbor in that
Okay,
case.
okay. So
We have searched our systems multiple ways, and we have found no evidence that we received a call from a neighbor.
okay, that's what so when you said modifications have been made to ensure what's
So a
been,
couple
what's
things.
been done?
One is now a manager will review every case that is not accepted. So it's another layer when they
Another
come
set of
on.
eyes.
When they come on to their shift, they will review the prior shifts, any case that a supervisor has determined did not meet the criteria, so was not accepted. They also review any case that involves a child in custody or foster care. So a child in foster care or foster parent. So they review all of those as well. That's just as routine now. I'm trying to think of the other things that they've done.
Medical.
So we changed the policy to about accepting from medical providers. If a medical provider calls on a child 3 or under, we will accept that report. And if it involves
What would have made you never, why would you have to put a policy, and wouldn't that have been an automatic,
No.
logical thing to do?
No, ma'am. There are situations where we receive information, and first of all, sometimes we receive information and it doesn't meet the criteria of a caretaker. So those would.
Oh, that's a different, that's,
go to
that
law
doesn't fall
enforcement.
within the children's, okay.
Sometimes it is, when you say a medical provider, it's not always, a hospital emergency room. You would assume those we would always take. But sometimes it's a doctor's office, a school nurse, who are all considered medical providers, and they may be telling us about a situation, but it really does not rise to the level of abuse or neglect for an investigation. And so in those cases, that's some examples that may not meet the criteria.
Okay.
By and large, medical providers, when they report, those cases are accepted. Medical providers, law enforcement, those two have the largest rate of being accepted.
And are your the intake people, are they employees? Are they
Yes.
contracted, or?
No, they are
They're straight up
employees who have,
employees.
yes.
And are you short-staffed there?
Yes.
I think we've got that information on how short. But is that, are you seeing that as a problem, or are you, is it been?
It certainly is a problem.
mean-
If we really wanted to, I have something here when you're saying, what would it take to significantly improve? When you think about it from each of our programs, more public awareness of child abuse and neglect and the reporting requirements. There is a flaw in the reporting requirements, really, in that a mandated reporter is obligated to report. But many times there are multiple mandated reporters at a scene. And one is assuming another one's going to report, another one's assuming another one's going to report. We don't really want 100 people to be reporting on that same thing. But there needs to be some way that if I'm the EMT who responded and the nurse is there as well, and the law enforcement is there as well, that if somebody's making a report, I need to know that everything, that they put everything in that report that was that I saw, and that was necessary for the department to have. And that is a gap in reporting right now. We don't have a good process for that. So what happens sometimes is one person thinks, the law enforcement might say to the physician, I'll make the report.
Right.
Or the physician might say, I'll make the report. So we don't always get multiple reports from all mandatory reporters. Sometimes doctors, as Senator Fessy said, the wait time, sometimes they have someone call on their behalf. And the information that's provided oftentimes is not nearly as detailed or explained in the way that the physician would explain it, to help the worker understand the severity or the implications of what they're reporting. So that's another issue. And part of that is, the time it takes to make a report. And it just does. There's a lot of information that needs to be gathered. We have put the reporter portal so they can go in now. They don't have to just stay on the line. If it's not an emergency situation, they can go in and report on the portal. One of the unintended consequences of that, though, one thing that has been difficult is that oftentimes it's not complete information. And so when we return the call or try to return the call to get the complete information in order to make the right decision, you can't find him. So the police officer who submitted a report might not be on anymore, and he's not going to be on for 2 more days. Or the nurse got off of her shift, or the teacher is back in the classroom. So those are some challenges that we are constantly trying to work through. It helps having the portal, but it also is gives us some new problems.
So if the call intake line is busy, they can go to the portal if they're already a mandatory reporter?
Yes.
Only mandatory reporters
Yes.
can do that, okay. But if they're not a mandatory reporter and they're calling the call intake, they can't leave a message, I saw.
No, they can get a call back, and they keep their place in line.
So they can leave their number and get a call back?
They will get a call back.
Okay, thanks.
But that would be one thing, is that, public awareness and then sufficient staffing where the wait time would be no more than 5 to 10 minutes. I mean, that would be ideal. It fluctuates, and the team is very good about calling people in quickly when the call volume goes up, monitoring it. They're very nimble about making adjustments, but sometimes you just don't have enough people to make that adjustment.
Well, I don't think, if it's feasible, people are going to wait. I mean, if they're committed enough to get the number and feel the burden to call about the concern about a child, they're going to wait. My biggest concern is that somebody goes out on the call, so. Anyway,
Certainly.
Thank you.
And
Mr.
Senator,
Chairman.
we have seen a big spike in the month of August, and that is normal. August and September are
Spike in calls? or spike?
I'm sorry, yes, a spike in
School,
calls.
because of school going back?
Yes, exactly. More eyes on the children.
Right.
Kids are going and getting medical checkups for school, and doctors are seeing things that are concerning and calling. And so there's always a spike in August and September, and we're hoping and praying that that goes down. But that definitely has impacted the call center and the response time from our agency.
The other area I will tell you that is promising if we put a real emphasis on it, and I know that the legislature appropriated funds for the early childhood comprehensive services. So it is there's a report from the National Commission to Eliminate Child Abuse Fatalities that outlines strategies that they believe are the most important strategies to have. And one of them is that anytime there's a report of a child under 3, that somebody would put eyes on them. Now, they recognize that the state agency does not have the authority to go out and investigate something that doesn't meet the criteria of abuse or neglect, but they recommend that there be some partnership with some sort of home health or some sort of home visiting program that someone could go out and visit the family. And so that is another area that we're looking at partnering. As part of Families First, we are implementing something called Child First, which is a very comprehensive program, in-home, intensive services for parents with young children under 3. Particularly, we're going to focus on where there are substance abuse issues. And they have a clinical social worker who's going in working with them, and they also have a partner with them that deals with all of the logistical kinds of things. The, do you have child care? Do you have income? Are you worried about being evicted? Is there other things that is preventing them from really taking full advantage of the intervention, the therapeutic intervention? And so that model is an evidence-based program. It's been shown to be very effective, and that is one that we are implementing here in Louisiana.
And to be part of that program, they would have to already have been in the system. How would?
Yes.
So that would be like a court mandated.
It could be.
Almost like a diversion court for a family in need of attention.
Yes, and in fact, as you bring up the courts, so we're working closely with Judge Haney, of course with Judge DePlanche. They have the family preservation drug courts, and those drug courts are another thing that's very, very promising. Judge Gardner in the Covington area has it also. There are a few of them, and those are very promising because it's very intensive. It's wraparound services. They're frequently in front of the judges, and you really see some change there. The capacity is limited, but they're very effective.
Okay, thank you. Thank you, Mr. Chairman.
Good line of questioning. What I'm going to try and do is, after the questioning, if I see kind of an action step, I just kind of want to note that for everybody. But it seems like if the committee would like to know more about what the pro tem was asking questions about, it starts kind of on policy 4.410 in your yellow sheet. It talks about intake decision, making with income reports, and it just continues where there's a tremendous amount of policies that kind of dictate what happens next. So if you do want to see that information. But my question is, as you look in the policies and procedures and the timelines and the execution shalls that say in there, do you have like an internal control where your compliance folks looks at how are they doing? If it was a shall of 24 hours, what's my success rate? What's not my success rate? Are y'all doing any of this compliance driven internally within the department? Because it's one thing to have a policy, but it's one thing to comply with policy.
We do have a continuous quality improvement staff, CQI staff, that are doing exactly that. They are monitoring and reviewing all of in every part of the continuum of care. So they look at intake, they look at foster care, they look at family services, they look at adoption. They're looking at all of that. And to an earlier question, that is a group of workers, that is a body of work that we believe we can contract out, that somebody else could do the quality control internal work, and then we could turn those staff who are highly skilled and have tenure and experience and knowledge, and put them in other positions in the state. And
so as you're looking at those compliance reports and how are we hitting our goals, what's the internal scorecard that you guys are seeing right now with that? I mean, when you look at it, how's the scorecard looking from the policies and procedure adherence?
It just varies tremendously. When you take into account that there are sometimes that we cannot find the person at all. So there are sometimes when the person is unable to locate. And so one of the reports in here, I believe they ask about timeliness.
Right.
There is not, the way the feds compute it is an average number of hours to making contact. And so it is not, it's very misleading, and it really isn't a good indicator of how often we make the right response priority.
But I guess if you had to look, especially in the leadership role that you all have, when you get that report, is the report saying, hey, we're doing a good job, we need to improve? We do know where our challenges are with labor, attrition, the market, everything, but when you're looking at the report
So we
as a
generally
staff,
do well in priority 1 and priority 2. Interestingly, where we do less well is with the lower level priorities, because they are running on the highest priority levels and making contact on those quickly, and the others tend to be less urgent and sometimes not gotten to as quickly.
Okay, very good. Well, and the last thing is, you said you were amending some of your policies. If you have some policies that you've amended that has some true teeth to it, please share it with the staff here, because I think that makes a lot of sense of where we're moving forward. And if you see you've amended some of your policies or procedures that make the department smoother, please share that with our staff. On that note, and what I'd like to do with the committee, if that's okay, once we finish the line of questioning, which we can continue, I'd like to call upon civil service, and we would like y'all to stay here, but open a dialogue with civil service in the department, because I know that was important to everybody here to talk about. So we'll go that route. Senator Carter, you're next.
Thank you, Mr. Chairman. I've been listening and reading a lot of the information that's in front of us. And I want to piggyback off of Senator Luno's comments, his questions about what can we do to help. And I know one of the articles that we have up here is it's actually a dated article. It's from 2014. It's talking about Alabama and Florida and what they did to turn around their department. And I'm looking at it, and one of the things it provides is an appropriation of $40 million to the Department of Children and Family Services to hire an additional 400 investigators, caseload workers for increased oversight. Have you all contemplated something like along those lines, a big picture? How do we go about tackling this? That this sort of appropriation at this sort of level to hire the sort of people in order to fill those buckets? Because these are 2014, 2015 numbers of $40 million for 400 additional people, just caseworkers and so forth. And I'm looking at our budget during that same period of time. From 2008 to 2015, I see all of these cuts, but I don't ever see a restoration of that. So have you all contemplated some sort of restoration of those cuts that your department experienced from 2008 to 2015?
We are working with the division on that right now, trying to figure out what the appropriate number is. We just had I don't know what you would call it, an internal audit. They studied multiple methodologies trying to figure out exactly how many staff we need, assuming our vacancies were full. How many more people would we need to carry the caseload that we currently have? And it's somewhere around 375. So that includes the 130 vacancies we have, that we have the TO and the money for, that we would have to add that many positions. I don't think that number includes the HR staff or the legal staff that we would need to keep those cases moving through the court system. So we are working with the commissioner on exactly that. What does the ask look like? And does it need to be staged? Is there the political will to hire 400 people when you have 400 vacancies? Because everybody says, just fill your vacancies. And I think Terry has the best explanation for filling vacancies of any of us. But literally, it is the number of the people carrying the weight. The weight doesn't change, but when the number of people gets smaller, there's just more pressure on the people carrying the same weight. And so until we can bring more people to lift that weight, we're never going to be able to fill the vacancies for exactly the same reason that we talked about before. If they both leave and I'm carrying the caseload, now I got both of theirs, what's that going to do to me?
I'm not trying to suggest that money alone will solve the problem. I think we all agree that it won't, that there are some other issues going on. But when you're looking at the 400 vacancies that you currently have on top of the loss of budget authority that you had over the years, I'm also looking at your average median pay of $20.64. And and I think these are numbers based upon May of 2021, and look at inflation, look at wage growth, look at the other pressures that we have. So as you're figuring out the ask, also, how is it best structured, to have those revenues? And Senator Fessy and I were talking in the back to make sure that we're taking care of those people that are hands-on, on the ground, those caseworkers who are having to do this difficult work, taking care of those kids, protecting those children in the state of Louisiana. So as you're contemplating the ask, the big number, but also make sure you're looking at it to pay well, to recruit the people that you need in order to get this work done. Thank you, Mr. Chairman.
Thank you very much, Senator Carter. Senator McMath?
Thank you, Mr. Chairman. So it seems like one of the primary issues that we continue to discuss is staffing and work shortages. I personally think there's one step above that, and in terms of leadership and the ability to inspire and motivate and recruit. And I know that's a lot easier for me to say sitting up here. Again, not taking anything away from how difficult your jobs are, but I mean, you wanted to be in this position, I would imagine. Okay. So there's a lot of, this is kind of a multi-part question, or statement, I guess. There's a lot of, in this document that we received today, expanding statewide strategies underway, expanding efforts to recruit, retain, and support staff, strengthening coordinated multidisciplinary responses. We've talked about a lot of these things, prioritizing this, coordinating that, boosting staff here, expanding some 7 bullet points. These are very broad, I guess, bullet points. Speaking of action items, I would love to, and I don't spend that much time in the weeds. You can ask my legislative assistant that, but let's dig into the weeds here. And if we can have an action item that is very specific to specific tasks that are being undertaken to do all of these things, most of which seem to be geared towards retaining or recruiting. I want to know to what extent we're reaching out to faith-based organizations. I can think of a number of faith-based organizations within my district that could be tapped to assist, to do some sort of cooperative, agreement. And the same goes, and Senator Luno brought this up a little bit, the community and technical colleges, engaging them, I think, to what extent are we doing that now, and do we have plans to do that sooner? I think that's a fantastic resource for the state. As a legislative body, we've injected some significant funding over the last few years into community and technical colleges. Could be a great resource for the department to recruit. So if we can add that to the list, staff. Now, I do have to, I keep coming back to this because I feel like once we open this up to public comment, or I know there's a number of individuals that are watching this committee hearing right now that are going to ask me this, and they're thinking in terms of their experiences. And look, we wouldn't be here, or they wouldn't be reaching out if the experiences were positive, okay? I think we can all acknowledge that. So in terms of when there's a situation where a foster child is under the purview or under the care or under the microscope of DCFS, and yet is still brought back to an abusive home. That has happened before. It's been reported widely. We all know the multiple instances in which I'm talking about. So this is not a technically theoretical, example. How does staffing address that? I mean, is it that you guys are so busy or so swamped that it affects, the judgment, and a judgment as basic as like a reasonable man judgment. I'm talking about a trailer that is beat to hell and back, where a child had been previously pulled from a home, prior year and then brought back. And I know we can't talk about specific incidences, but do you see what I'm saying? I mean, there's going to be those questions of, while we understand staffing is a major problem, but like, what about the kids that are currently under the microscope of DCFS, where the state has failed them? You see, just, that's going to be probably brought up, in specific instances. And so I think we, at the very least, need to address that harsh reality. So
one of the things that I would say to that is that we are there, it's a system, right? So it's not just the child welfare agency. So there are the courts involved in this as well. And as you, I'm sure, know, we cannot remove a child or change custody back to a family without the court decision. The court decides that. We can make a recommendation. Sometimes the court agrees with us, sometimes they don't. When a child is in foster care, they also have an attorney, and that attorney is advocating for that child, and the parents have an attorney, and that attorney is advocating for them. So just because a child gets returned does not necessarily mean that the department agreed with that situation or thought that it was safe. I'm not saying that in any particular situation. I'm not talking about a particular situation. I'm just saying that it is not our decision about whether to return or not. So we do make a recommendation. We do present information to the court, and the court makes a decision about what happens to the child. So it is a whole system at play. Sometimes it's the attorneys representing the parents who are quite good and effective, and they win out on it. So much to our concern sometimes. So that's one piece of it. I would agree with you that just because we're short doesn't mean that we should make a recommendation that doesn't make sense to send a child back to a situation where they're not safe. No, that should not happen.
Senator McMath, one other thing I might add is if we didn't have the turnover that we had, it would be best that a child had one worker that would know that child, have a relationship with that child, and really be able to follow that child all the way through. And so one of the more concerning reasons why turnover is a problem is because that's very not likely that a child is going to have one worker that really can understand the difference in that child's demeanor the next time they go and check on them. And so I do believe that I really appreciate the committee's concern, because if we can start looking at what are the level of cases we have now and how many workers do we actually need to stabilize the caseload for the better outcome of the child, I think that's another reason why we really should do that. I was actually the undersecretary in 2014 of this agency. And so I can tell you then that every one of the positions that we had in child welfare at that time were being used. And we were actually still asking for more workers because we had greater specialization at that time. Greater specialization would allow us to get someone to a level of being able to understand drugs and get them out there, for example. Now the cases are, the majority of them are complex and difficult, as opposed to having a certain smaller percentage that you needed to have a specialized. And so now more than ever, we need a more specialized caseload. But I think if a child really had a caseworker that stuck with them the whole time that they were in, that child would have better outcomes, and the nuances, right, that may not be available to a new person using their view, they would miss it, right? And so that's how I see stabilizing the caseload, really making a bigger difference for the children in that way. And I really appreciate that question.
Yeah, well, Mr. Ricks, I appreciate your comment, especially, there's been a significant amount of talk today about how, difficult it is for the caseworker or for the employee, whatever it is. And you just hit on the fact that ultimately, though, this comes back to the safety and the protection of the child. That's the ultimate goal. And so I see it as if we can increase the number of resources, make the lives of the existing caseworkers, DCFS employees better, that supports ultimately
The children.
that comes down to the child,
Yes,
which is
sir.
the ultimate goal
That's right.
of what we're trying to do here. And listen, this is nothing new. I was reading an article just this morning in Illinois. For over the last 9 months, they've had 10 deaths that were directly under the care of their DCFS, their version DCFS in Illinois, and that has forced them to have very similar conversations we're having now. So I acknowledge that this is a national issue. It's just, again, thank you for shining the light on the fact that ultimately it comes down. The whole purpose of this is to protect and ensure the safety of our most vulnerable children. So thank you for that.
Very well said. Thank you, Senator. Just to follow up on the action steps that Senator McMath would like on this one-page document, there's basically some goals and some criteria. One's the solutions we're working on, and the other one is statewide strategy. So it would make sense to put a little bit more meat on the bones of how we're doing it,
Absolutely.
what's the timeline expected, and what would be the positive results. So we'll put that on our to-do as a team that we're working on that. Senator Hinchkins, is all yours.
Thank you, Mr. Chairman. Just two quick questions, and it's follow-up on Senator McMath's questions. And if y'all don't have the information today, that's okay if y'all can get it to me. I'd like to know how many times this year DCFS has asked the courts has requested they did not return, that y'all have gone to the courts and said, we don't want them to return to the home, and then a percentage is how many times the courts denied DCFS too. I know you probably don't have that today, but if you could get that to me, I'd appreciate it.
Annual case.
Would you be open to looking at one court and doing some, because it's going to take a manual effort to look at
Then
cases and all.
Can we do one
so-
court system in the Baton Rouge area and
Yeah,
give
for a
us
certain
that?
period of time. Yes, sir, we'll do that and turn that back over to you.
Thank you.
Thank you.
Thank you, Mr. Chairman. That's it.
We're going to call upon civil service. And oh, you had a question? Sure, Senator Luna, I'm sorry, I missed it.
Because, and I appreciate your effort and what you're trying to do there, but I don't want us to lose sight of the fact that every one of these cases are fact-driven, and we cannot go into the facts of every one of these cases because the records are sealed, they're juvenile records, and you can't do that. So the numbers may not tell the whole truth. So we have to be very careful about what we do in that regard, because look, I worked at DCFS 30 years ago a lot. I really did. I understand. I've heard people come in and say, oh, they're the Gestapo. They came in and took our kids for no reason. And then there are others saying you got to take these kids from them. And everybody has an opinion about what's in the best interest of the child. And it is tough. And the the Department of Children and Family Services workers, sometimes I agreed with, sometimes I didn't. But the fact of the matter is there are multiple layers of people. CASA, for example, is one of the ones that does an independent review, and that's their job to do that. The courts, have various people that work for them, so we need to be careful of not just getting raw numbers and saying, here's the answer. Although I think that's a very good idea to look at those numbers. Thank you.
Thank you, Senator Luno. And I really was not trying to say that is a common thing and that the courts overrule our recommendation. I guess the point really was that it is a full system, and so there's representation and opinions and brought in from lots of places, and CASA is certainly one of them as well.
Thank you, Senator. President Cortez?
Thank you, and I want to also thank Senator Luno for that, because we all have anecdotal stories from our district. This morning on the drive up here, speaking on a different subject to someone who said, "What are you going to the Capitol for?" And I told him, and he said, "Well, I have a story. Let me tell you." And so we all get these stories, and whether the facts are misinterpreted by the cousin or the brother-in-law or whatever, we get those calls. But so in order to not be anecdotal, and I try to be pragmatic about things and look at the big picture, and that's what I'm attempting to do today, it's clear that there's one major glaring problem, and that is a lack of employees. And to the extent that that could be fixed or could have been fixed, it in my mind, the potential of fixing that would have done two things. Would have reduced potentially the strain and stress on those who are currently working, and it would have reduced potentially those who chose to stop working because of that stress and strain. Both of those would potentially, and I don't want to say would have because there's no definitives here, potentially would have saved lives.
Yes.
And so I know we're getting ready to bring civil service up, but I want to know, if we knew this, when did we start the motion, the wheels in motion, to say we got to get people in the door? And I know we've talked about recruiting efforts, and I don't know if Senator McMath and I were talking earlier. I stepped out, but Senator Mills mentioned earlier about partnering, public-private partnerships. We were talking about faith-based operations earlier. To me, it was. I guess it's now a question of when did you know and how urgent were you to fix it? That's really to me the overwhelming issue here, because we can't go, as I like to say, we can't go unring the bell. The bell has been rung in a lot of these cases. We can't go backwards, but we have to look at why those bells got rung and not let them ring anymore and going forward. So anyway, I don't really need a response. I'm going to let civil service come up, and they're probably going to give some of those answers. If you'd like to respond, you certainly can, though.
And I have one line of follow-up question, and then we'll bring in civil service, if that's okay.
I would like to speak to the faith-based initiatives. We did meet, we do have several partnerships around the state, and we met in Baton Rouge about 3 weeks ago, or maybe, 4 weeks ago, with several churches that have committed to take on recruiting, training, and supporting our foster parents, and doing it within their congregation and opening that up, much like Crossroads NOLA does, that you're all familiar with, much like their model, if you will. And they have expanded. Crossroads NOLA has moved to Shreveport, so we're picking up there. That is a huge relief to the department. It takes away some of our staff that does that training and recruiting, and so that will give us staff then that we can put into other roles. And that's one of the things that we're looking for internally in every nook and cranny, is where can we alleviate, as you've talked about with public-private relationships, where is something someone else can do that will free up some of our staff to do the work, to put more people into the fight. So just to answer that specifically, we are definitely looking at that, and we'll be doing that across the state in every community, not just in Baton Rouge.
Okay, thank you.
Chairman Mills, would you allow me to correct the record? I think earlier I said that I was undersecretary in 2014. I'm sorry, I meant under Governor Blanco, which was way before 2014. But it was around 13-14 that the decreases in staffing in Louisiana was happening. When Senator Carter was talking about in 2014, they were increasing in Alabama. So please, thank you for allowing me to correct the record.
So noted. As we're working on it, and then we'll bring in civil service, and if some of y'all want to stay at the table, I have the dialogue with them, that'll be fine. But I did want to bring this out. Over the last couple of days, I've been kind of reading on the website, and it's the Louisiana Department of Child and Family Services, Building a Stronger Louisiana. So I've been reading that report, and I read on November 6, 2019, the Department of Health and Human Services basically approved the plan and said to move forward. And it was a very positive letter. In there, and this is where we don't need to drill into it today, but I'd like to kind of give a homework assignment to the department to address this. But on the report, on page 11, it starts talking about child welfare vision statement. And it talks about a lot of the things that Madam Secretary, you and your staff talk about, the vision that you have, which we're all in 100% agreement on. And then the department identifies child welfare priorities. And a couple of the priorities are, and this was in 2019, a competent, stable workforce invested in carrying out the child welfare principles. And it has some other things too. Improve technology for maximum efficiency and effectiveness in practice. And why I'm bringing out there are bullet points of goals that you and the federal government pretty much put in that plan that approved. I'd like to get some of those results of where we're at, because there's a lot of lofty to-dos and just where is it at with it. But then the part I'd like y'all to address also is, it talks about Section 2, the assessment of current performance in improving outcomes. And it looks like there's 7 factors that I think the federal government and y'all work on together. And I looked at the 2019 report, which is 2020 to 2024, and it talks about safety outcomes, and it has different items, and we're, as a state, are 69% compliant. It talks about safety outcomes number 2, we're 14% compliant. It talks about item 3, and I could go into it, it's very lengthy, but item 3, we're only 12% of cases that received a strength rating, 12%. Permanency outcomes, 20% compliant, 22% compliant on compliance outcome. Well-being outcomes, 14% compliant. And a lot of this filters into what the discussions have been. I could continue on and on. So what I'd like from the department is that section that deals with this specific issue, give us a report on where we were in 19 and where we are in 2022 and where we hope to be in 2024. I think that would be very beneficial as we continue these discussions. Thank you all very much. So why don't we call in civil service, and if any of your experts want to sit at the table with them as they discuss kind of where we see the future going. We hear that y'all in discussion, so why don't we open that up for the panel to begin discussing. So please just introduce yourself, tell us your role, and we'll go from there. And thank you for your patience and your short notice.
Not a problem. Good afternoon, Senator Mills. My name is Byron Decato. I'm the Director of Louisiana State Civil Service, and I have with me Ms. Nicole Tucker. She's our Chief Operating Officer. Just would like to say thank you for the opportunity to come before the committee this morning and be able to answer any questions that we can. We have been working with DCFS on some of their issues, and we remain committed to them and open to provide any resources or solutions that they may need. So I'd be happy to answer any questions.
So from a standpoint of what Senator Luno said earlier and some of the committee members, if the department sees some certain innovativeness, that, some things that could be really not the norm in civil service, but could maybe help to stop the bleeding, how flexible are you? How much do we kind of need to understand about the process, the constraints you're under, but the flexibility that you may have working with the administration?
I think we do have a great amount of flexibility as long as we're working together with the administration and the legislative body. Of course, there's been a lot of discussion about pay, and that was one of the initial things that we did with this department, was institute some premium pay for their Baton Rouge office to stop that bleed of individuals turning over. The flexibility with that comes with the funding that's available for the agencies, and then ensuring that our system is consistent throughout with other particular jobs. Now, what's unique about this department is we're talking about a job series that's unique to this department. So when it comes to wage and hours, of course, that's something that my commission and the governor approve together, but certainly we work with the legislature because we want to make sure funding is available before we do any type of, mass hiring or approving of increasing rates. Some of the things that were discussed earlier talk about the hiring process. So, for example, Typically, in state government, when you post a job, you're posting a job to an open position, so applicants know that position is open and they are applying specifically for that vacancy. Our role at Civil Service is to qualify those applicants compared against the minimum qualifications that have been set up by the agency and the Civil Service Director. So we work with the agency to determine what qualifications they need for their particular jobs, because they're the ones with the boots on the ground. They're the one who knows, their hiring managers know their needs and what type of applicants they need. Typically, we recommend that the announcement be announced for a minimum of 5 days. We do have a turnaround time of 3 days. Typically, we are able to get that list of candidates to the agency anywhere from a day or a two. Rarely do we take the 3 days. In this particular agency, they do have a continuous announcement, which means applicants continuously apply. So there's no closing date. So at any particular time they want to hire, we are able to pull a list of eligible applicants and send that on to the hiring manager. I know that Ms. Rick spoke about a discussion with the Division of Administration, and one of the things that we have offered is we have offered our staff to go on site around the state with the department to actually talk to applicants and qualify applicants right then and there, so they can then be moved on to a hiring manager. So a hiring manager can do an interview and hopefully potentially be able to walk out the door with some sort of conditional offer of employment. So those are some things that we are certainly capable of doing. I think this opens some opportunities for looking at the minimum qualifications for these positions and working with the agency. Now, the agency, and I'm not an expert on all of their qualifications, and some of the qualifications may be tied to some federal requirements and so forth, but I'm not sure which member I wrote down that you were talking about, could we get a clerical person in and help, and hopefully then they may be interested in doing the work of a child welfare position. We have to be mindful that those positions currently have a degree requirement. We may need to talk about, is that something that we may need to loosen up? Is that an opportunity, or is there some risk involved in that? And that's the discussions that we would have to have with the agency. So overall, we are very flexible to be able to meet the needs. When it comes to pay, the pay is going to be the funding portion of it. I know that one of you mentioned about being able to go work at McDonald's for $20 an hour, and that is something that all of our agencies are faced with. Just to put in perspective for you, our commission, I prepare an annual pay plan report every year that's going to be presented to our commission next month in October. Just to give you some figures for state government for classified employees only, and this is strictly salary, it's not related benefits, but if you wanted to match a $15 an hour of what's being paid at Target, we would need a minimum of $337 million to make that happen. So those are the financial implications and the funding that is necessary to allow for that. Now, what we are doing currently, because agencies have high turnover, is we are approving special entrance rates, which is a rate that an agency can get from our commission that is above the minimum rate for that particular position. So for this particular job series, they have a special entrance rate. We have traditionally given them a special entrance rate and then have tried to keep up with the market for their particular jobs. But there's a minimum. The current minimum, I can tell you, for a child welfare specialist trainee is currently $29,640. That's the minimum of the pay scale for that SS 411. That's a pay scale. They did get approval from our commission, and the starting salary is $36,524.80.
So from a standpoint of fairness, do you have to do an adjustment to the people that were maybe brought in before the special carry?
Certainly. We do look at compression, if compression is going to be an issue. I do believe when this was implemented, every existing employee received...
It was a 10% corresponding adjustment. We call it corresponding adjustment.
The folks that were there earlier are compensated.
Yes. And in addition, we have implemented a premium pay for these individuals based upon their longevity at this particular agency. So 0 to 3 years is up to $2 an hour. So that's an additional $4,160 a year. So a potential starting salary coming in the door, if you add that special entrance rate and that premium pay, if they work the full amount of hours in that particular year, would be $40,684. Now, please keep in mind that, we have annual market adjustments for our classified employees. So those individuals would be eligible for a pay increase in July of each year. And then I know Ms. Tucker knows the qualifications more than I do, but in the series, you can be reallocated. So you may get a 7%, and then you get another market adjustment. Then you may be reallocated again. So there's potential for growth. The issue with this current particular job series is not unique to Louisiana, as the Secretary pointed out. I sit on the past president of the National Association of State Personnel Executives. It's always correctional officers and child welfare is the top of the list in every single agency. So, that is something that I want to point out. It's not unique. And I think we're talking a lot about staffing, and it is an issue of staffing. The employees are burnt out. And we see this with correctional officers, juvenile justice officers, that they need more people because the applicants these days, it's interesting because Senator Luno, you spoke about 1993. We go in the file room and we see these same issues from 1954. So the issues come back full circle. But it's challenging right now. Our applicants are down about 50% from pre-COVID. Our vacancies are up. We have individuals who are looking for workplace flexibility, work-life balance. Pay is usually third on the list. When they're coming, they want to know, can I work from home? What are my flexibilities for my work-life balance? And then what is the pay? But you have a position like this with direct care, you can't offer those flexibilities. And upon that, with the vacancy rates that they have, these individuals aren't able to take the leave when they need to take leave. You've heard them having to work overtime and stay with the children at night. So it's the stress of the employees. All of the things that the department spoke about are something that I think that we should definitely look at, looking at EAP programs, employee assistant programs for these individuals who have to deal with trauma and return to the job. So it's a lot of challenges that they're looking at when it comes to hiring, but they do have our support and they have our 7-member commission support. As I said, we in the beginning, about a month ago, we did approve some unclassified temporary positions for them so they could get people in. Where that, they could hire, if they saw Senator Mizell was interested, they could hire her today. And then we did premium pay for the Baton Rouge office, which was $5 an hour. And then $2.50 an hour for is tiered based upon the staff. We also are going to be recommending to our commission to extend that to, because I approved that on an interim basis. So it goes to the commission tomorrow, actually. And it's likely that they will approve that. I'm going to make a recommendation to them, and hopefully they will go with that. We are looking to expand that pay. The department has asked us to expand that to New Orleans because they're seeing an increase in calls that are accepted and so forth, and want to make sure that they're being proactive. And then we're also recommending an incentive pay policy for their employees who are taking from other regions to work in the Baton Rouge region, where they would get a lump sum payment after a certain period of time. So once a month, they would get a lump sum payment of up to $2,500. So those are some of the initiatives that we have taken so far, but again, are open to anything that the department or this body would like us to explore.
We have a few questions, but a couple of things. One, I just wanted to bring this out that was brought out in testimony. The team that was up earlier said that they were contemplating get very innovative to have retired police, to have medical. If they don't contract out and they bring them within the team, will that be a long-term challenge for civil service to address new job descriptions? And basically, would that slow the train down at all?
If you're looking to contract out, what the courts have said is that it's not our decision to determine whether or not a service can be provided by a state employee. What we have to look at is if they have existing employees that they want to replace with a contract, that the contractor has to come and the department has to show an economy and efficiency to the state. So there's no barriers for them to be able to contract and supplement their staff. Some of the things that we have seen, especially during COVID with nurses, for example, the contractor was able to pay a lot more, and it brought down morale a lot. So you do have that. That's an obstacle. But yes, they certainly do have the ability to supplement their staff.
And if they do put a team in to hire retired police, medical folks, will that be a burden from the department, from your department standpoint, with new job descriptions, new classifications? Will that delay their process any? Because it seems like they're ready to roll with this.
If they're looking to put it in the classified service, certainly we have a team. I have employees, approximately 80 employees that would work on for operations for state agencies. So we could get those job descriptions, we can make it a priority. But I'm hearing is a contract that would not be through us. But if it's additional employees through us, we would give it the utmost priority to get that done. And we can even assist in developing some of those job descriptions.
Thank you. And last thing I'll turn over, I guess this is for everybody, but I know some industries are reaching out through each parish's economic developer. Almost every parish has an economic development team. And almost every parish is very familiar with having a job fair. They partner up with the universities. They partner up with the technical colleges. They partner up with retired military. Would this team that's talking here and talked previously, y'all may want to reach out to all the economic developers in all 64 parishes to say, how can we do a real boots on the ground outreach, because they know their area as well as anybody.
Thank you, Senator Mills. Terry Ricks, this also came up in our conversations with the commissioner, working with Louisiana Workforce Commission and therefore with the economic development. So thank you for that. That's kind of doubling down on that idea about, and also you guys, like when we're in your area, let you know so you can send some of your constituents to us. That would be also very helpful.
Yeah, I can promise you every parish councilman, every mayor, every elected legislator would be at the job fair. They would invite folks to be there. They would probably reach out, like I said, to retired military. I think that would be a great outreach to get us all involved.
Thank you.
So, a line of questions. Senator Mizell?
Thank you. And Mr. Chairman, to follow up on what he opened, when you said there's a standing order, they have a standing request for jobs that never closes. That is something they tell you then advertise for that?
So the position, typically a position in state government is, look, we have this need. Can you post this position?
Right.
We'll post it for a minimum of 5 days. Some agencies like to do 2 weeks to get greater applicants. But in high turnover jobs, we do have some announcements that are continuous, so they don't close.
Right.
So
I
the
understand
applicants
that.
are steadily applying. If Terry is ready to hire someone, she will call me and say, can you pull the list as of today? And we will send that list of qualified applicants to her.
So you know the position. But
Yes.
my point is, I have to come looking for you. What I see people doing now is social media boost.
Certainly. Mhm.
Do you do that?
Yes, ma'am.
So you're at, and when you do that, are you doing it in a unique way for the need that exists as far as, okay, I'm just going to tell you. You can't watch a TV show without something about an animal needing to send $9.
Mm-hmm.
Okay. Heartstrings are immediately
Yes.
pulled.
Mhm.
You have an incredible heart-pulling situation here that people, CASAs do it for nothing. And they do it because somebody saw a billboard with a picture of a child that they thought they could do something for that child's life. This is, I just think this is, they're not doing it for the money. We all know that. But
Yes.
there's a hole to be filled, and, we all want to do something. Anyway, I just would really hope that you all don't treat it like you're a correctional officer.
Oh, no, ma'am.
Because this is a totally different opportunity for people. So
We do provide the resources for social media. We will do graphics for agencies to use in their campaigns, their job
Right.
postings and so forth.
Right.
But we would look for the agency to tell us what type of content they wanted, but we would be very happy to work with the department.
Okay, okay. Thank you, Mr. Chairman.
Very good. Senator, you and the president tied on the button. Senator Cortez?
Thank you, Mr. Chairman. I was going to acknowledge the fact that you hit the nail on the head with regards to corrections, and Office of Juvenile Justice and probation and parole is another one. And DCFS have the highest turnover in all of the agencies that we fund. We constantly see the turnover. So it's not, you're right, this is not a unique to, or I should say it is unique to these agencies because of just the nature of the job. I wanted to clarify one thing. You mentioned something about the entry-level position that I was asking about earlier. My point, and I want to be clear on this, is that when I mentioned the book Good to Great, you get the right people on the bus. You can hire someone at an entry-level position. We do it all the time. In education, they hire teacher assistants while they're getting their degree. Then they move into the teacher position. My point was, you can get someone doing clerical work who's working towards that certification or degree so that they can move into the caseworker role and get a higher salary. That was the point of getting people on the bus, relieving the caseworker, but also nurturing the next caseworker generation. That was the point of that. You mentioned incentive pay and the lump sum. So I'm going to take us back to when we talked about the group that goes out, and they mentioned in the group there was a potentially retired law enforcement component or a medical component, which could, I assume, be someone who was maybe an EMT or maybe a nurse or whatever that could be moving later in life. So on the one hand, you have those moving out into the workforce for the first time that you want to be able to incent them to progress. But a retired police officer, civil service has a rigid structure with regards to salaries and benefits. If they're already getting their benefits, they don't need more benefits. They don't need to pay into another retirement system. Maybe they would. But is there any flexibility there to give them a stipend? To say, you know what, unclassified stipend, go to work. They just want the cash. You pay me, let me go to work, keep me, take the hurdle out from in front of me of having to pay into the retirement system, having to pay into the, to the group benefits. I already got my group benefits over here. I guess I'm asking that to ask the next question, which is, these are all sort of out of the box type things. I know that's not what civil service mostly creates boxes and says, we got to check to make sure you do this, you got to check to make sure you do this. And when all the boxes get checked, then we send you over to the agency. Is there been any barrier or request that had a barrier that has not been removed with this agency?
In regards to
any hiring?
To any hiring?
If they said, listen, I need this person right here, and yet one of the boxes didn't get checked, and they said, sorry, we can't send them over to you.
The only thing I can speak to is potentially minimum qualifications, because our staff at Civil Service, we look at applicants and
Give me an example of a minimum qualification that would not have allowed that person to move forward.
So they have 4 different options on their job series. You can have a bachelor's in a non-related degree or a related degree. So related, I'm talking about something like psychology, social work. That's what they would consider a related degree. A non-related degree may be a bachelor's in business per se. And then you have to have specific child welfare experience, or you can have social services experience. So those are some of the boxes per se, if you want to talk about that. Now, as Byron talked about, he said that, we work with the agency, Child Welfare Series is very specific to DCFS. So we work with them, whatever they're kind of communicating to us that, hey, we need this box. That's kind of the box that we created. And I also want to put out there, we actually just worked with them and partnered with them to update the minimum qualification. So we actually made that box a little bit wider per se. So we actually actually broadened the applicant pool for them. We did that in June of this year. I can't give you a specific example, but that's probably the only thing that I can think of that may have been a barrier per se, is if the agency came to us and said, hey, we really want Byron, he's got XYZ experience, and we disqualified him per the minimum qualifications. That's kind of what triggered almost, to be honest, us updating the minimum qualifications, because they realized they were missing out on a lot of people that had that barrier there for them. So we actually broadened the pool for them. Data, it's only been a few months since that went into place, that minimum qualification update. So we don't have the data. The agency maybe can speak to if they're able to get more people, but that's what triggered us working with them for a few months to actually broaden that applicant pool for them.
But this is agency standards, you're saying? So you don't create the standards, you simply just apply the standards created at the agency?
Because this job series is specific to DCFS, we rely heavily on what the agency is kind of telling us what they need and who can do that job versus, let's say, a social worker, which is a job series that's used by multiple agencies statewide, or an accountant. That's something used by everyone. A child welfare specialist is specific to this agency, so when I say working with the agency and that box and that barrier, it is something that we partnered with the agency on, and we rely on them to tell us who can do this job or what they want to see in those minimum qualifications.
Yeah. And the rules require that we work with the appointing authority. I set the minimum qualifications, but we work with the agency to develop those. And those are something that we can change very quickly for this particular agency because they're the only agency using these job titles. As Ms. Tucker said, if it was a job title used by multiple state agencies, we would have to have outreach with every state agency. How will this affect you? But some of the things that we have seen effective with other agencies who were struggling for applicants, and we can certainly do it for this particular agency. Ms. Tucker may have already done it. I apologize if she has, but we were able to look at applicants that were not qualified and give those experience, the qualifications of those applicants to the hiring managers and say, these are the people that we disqualified. Do you think that they could work in your particular area? And then work with the agency to, work and massage those minimum qualifications.
That was part of the conversation when we worked with them recently to update the minimum qualifications. We had a staff member go back and look at the applicants that we were disqualifying based on the previous minimum qualifications, and in conjunction with the agency said, hey, these are some of the people that you are consistently missing out on. So we went back to them and we gave those examples, and from that came up with recommendations. And when I say it was a partnership, it was a lot of recommendations. The agency came back because obviously they know their business more than we know it, and they said, hey, this will work, this won't work for XYZ reason. So that's why that was that dialogue kind of going back and forth with the agency to get to where we are now with those current minimum qualifications. But as the director mentioned, it is something that we can update fairly quickly, but since this is an agency-specific job series, we kind of rely heavily on what the agency kind of tells us what they need.
And so, I'm going to give you an example. Again, we could get anecdotal, and so I don't mean to put you in an awkward position. But so let's say the minimum standard is a bachelor's degree in a field or a related field, I think you said. So a person with an associate's degree is disqualified.
Yes,
Okay.
for this particular one,
That
and
particular-
I'll say that because for our jobs or degree level jobs is what our professional level jobs, which are basically jobs that require a degree. We have on most of those jobs a substitution is what we would call it. So that would be a 6-year sub. So 6 years working basically will sub for a bachelor's degree. And then with that, we also have kind of a calculator per se of if you have an associate's plus X amount of years, that will equate to that 6-year sub. That will equate to a bachelor's degree. What I'm speaking of right now, that is not on the child welfare specialist series. That is something that we could absolutely entertain putting on that. But again, working with the agency, this job series does not have a substitution on there. For someone, like you said, that has an associate's, that person would be disqualified.
So I'm going to ask Ms. Rick, so what's we always have to kind of have a balancing act. So what's worse, having somebody that actually wants to come do the job and maybe might be 2 years of college short to qualify, or having no one come in the door and having 2 people leave because they don't have enough help.
Yeah.
I mean, if that's the challenge you're facing, to me, I'm going to pick this and say, give me that person who is clearly in somebody's mind, competent to do something. I use the example of what if they had a Bachelor of General Studies with a minor in behavioral science, but they didn't quite rise to, they may even have a bachelor's degree, but they may not be able to sub it. That's my point about sometimes we create too many boxes, and instead of getting what I call somebody who's energetic, who's intelligent, compassionate, and educated enough to do a job that we all know. Look, again, I said it earlier, I was a school teacher. You think I learned in my education program how to teach school?
Right.
You put me in that classroom, and that's how I figured it out. And so, and I use a lot of education anecdotal stuff, but it's something you may not be aware of. You can have a bachelor's degree in social studies education and teach American history for 30 years, and you're not qualified to teach at a higher ed institute. But yet you get a history degree at 22 years old. You're qualified, a master's degree, in history. You're qualified to teach college, but you can't go teach high school. You can't even teach 8th grade because you're not certified in education. So we put hurdles out there. I'm not saying that's wrong. I'm saying that's sort of just how we do things, and sometimes we aren't willing to be flexible enough. Senator Facey said sometimes businesses, and it's just different. Businesses are like speedboats. They can turn on the dime. Government is like a freighter. It takes a long time to turn it. You feel it turning, but you never quite see the horizon change. The other one I talked about, so that's on the qualification side. There's 2 sides to this, I believe. The other one is on the financial component. The unclassified worker, generally speaking, is a person who's more portable. They want to come and go. They may not be there for 30 years. They may not be interested in all of the benefits that you're going to want to throw at them. They might say, look, hire me for 2 years while you're shorthanded. I'll come give you the best 2 years of my life. I'm 58 years old, and about 60, I'm going to travel. But I can give you 2 years. I'm retired from the police department. I'm retired from, Acadian Ambulance or whatever. I've been doing EMT work for 30 years. Or just pay me a stipend every day. Do we have the flexibility to do that?
Senator Cortez, while I wait on Byron to give you an answer for that, let me say that we do use a step, not lower, but different for those who want to come in the door. We use a social service analyst position. And that one, if I'm not mistaken, does have a substitute. This is where someone with an AA and experience could possibly get in, and we call it it's right before the child welfare series. So if you want to get in child welfare, where we are expecting a little bit more training, a little bit more education, then you can come in through the social service analyst. I think this is where, when we first started doing some of this review and working with, so we've been working with civil service for 6.5 years, let me just say it that way. But this particular time, the social service analyst, for example, does not have a special entry rate. And so they're still coming in really, really low. So it's something that your ideas help us, right, to make sure, is there another pathway into child welfare that has a substitute that still allows for us to marinate in a space and bring them in. I think the other thing that...
But experience inside the building could help with that as well. I mean, you're talking about supervisory levels where I can't imagine 2 things. One, you hire a person quickly, and look, we all are conscientious because we have to deal with the money. And we know when they come in, if they're locked into that position, probably not going to leave. And if they're not doing a good job, that we're probably stuck with them. And if they're doing a great job, likely they can go to the private sector and make more money. They might do that. So we got to find that sweet spot, right? Mm-hmm. Where it's a good environment. They love what they do. We get them in there, but could we pay them a different way? Mm-hmm. Like in business, you sign a contract. Okay, I'm a 1-year contract. At the end of the year, we'll revisit. But again, I go back to, this is my diagnosis. I'm not a doctor, but I'm not trying to give a prescription without diagnosis. I think we've diagnosed the problem. The problem is we need more bodies. Mm-hmm. And we need more bodies that are competent, at least in the eyes of their manager, and their supervisors to do a specific task. And so, we talked about the managerial layers. You give me somebody tomorrow, and I promise you, he's going to tell me within 2 months if that person's going to stick around or not. But give me the flexibility to take his word and say, they're not getting the job done, I need another body. But if they're getting the job done and he says this is a superstar, then I want to be able to see if we can get him in a track to get a degree and get him into the next level. But we need to take the freighter and put it more like a speedboat, I guess is my analogy, is let's be more flexible. Let's be able to turn in a different direction and come up with some of these, what I would use as business hiring techniques to say, let's treat it a little bit more like a business and a little bit less like government. And I'm not finding fault with either of that. I know that you have a job to do, and the statutes that are created by this body require you to do certain things. But to the extent that we can reduce the barriers, be more flexible, get more bodies in, I think we're going to have less attrition.
And I would just like to say one of the flexibilities that we have given is in the beginning when they came to us, we did approve some unclassified temporary jobs, up to 50 positions. Therefore,
and those had no qualifications.
Have no qualifications. So we
removed that barrier. That's
yes,
great.
Because what we were hearing was we have people, but we don't exactly know exactly where we're going to be able to utilize them. But we have people who are interested. So we did give them unclassified authority under my approval to see how that works and see if we can get some people. Right now, I think it's maybe just for 6 months, but we would evaluate that at the end of 6 months, potentially extend that. Could we get people into the classified service? But we did allow for that flexibility.
Senator Cortez, this was exactly, when we asked for this, it was exactly what you said. Let's get more people on the bus and then figure out where they fit. Because we have been able to identify some good people with good experiences. Maybe they hadn't figured out all the different ways to get which job yet. And so we're doing both. Everything that we can to fill the positions that are out, and then what are these critical hires that we can make right now, and then either wrapping around Baton Rouge or determining, okay, here's the spot for them to be in, and being able to get them into a classified position if that's where they qualify and what they want.
And I know the Secretary mentioned earlier about the name storms and the hurricanes and all of the difficulties. But for the public who doesn't know this, quite often this agency is the front line in the triage units of these hurricanes. They're the first support that gets out there into the field. So the agency has been stressed because of the lack of people. And I see it as a real simple, not simple in any way, shape, or form, but I see the answer as being simple. We got to get more people who want to be there. The question is, how do we go about doing that to relieve the people that are in the building already? So thank you, Mr. Chairman, and I appreciate it.
Very good line of question. I guess just to accentuate from where we would like y'all to be is, if you look at the analogy of the Catholic Church, they ran out of people, so they had to start letting lay people give communion after extensive training. So when in doubt, think of the Catholic Church. If they allowed certain people to give communion, a lot of flexibility. Okay. A lot of flexibility. So we'd ask you to be that flexible. Senator Luna, all yours.
Thank you, Mr. Chairman. The President's questions covered most of the areas that I want to talk about. I think that what we're trying to tell you here today is that you are an agency to create boxes, and that's a good thing, because you deal with issues like nepotism and cronyism and all those other isms that politics create, and you can't ignore that. But at the same time, when you have a crisis, you got to think outside the box. And that's where we're at now. I think that was a great move, the unclassified jobs, allowing people to come in. That's something that, in normal times you'd say we don't need to do too much of that, and we don't. But we need that kind of outside the box thinking right now. So I applaud you for that. One of the things that I wanted to mention too is when you talked about one of the entry level positions paid about $30,000 a year. That's one of the direct care workers, I'm assuming, that works directly with the kids.
The child welfare specialist trainee. So that's the entry level position into the series, basically.
There was a time when we offered a great benefits package that made it all worthwhile. I can go to work for the state because they have this great benefits, and I can retire from there. Well, those are the things of the past, and we don't have that to offer anymore. And so when that comes out to be around $14.25 an hour, and that's before overtime. And I know overtime is a huge problem for the department, as it is for every department. And sometimes we deal with things like K-time and stuff like that. Well, the employees that I talk to, the state employees, don't like the K-time process. Sometimes they're forced to do it. They don't like to do it. They often lose it because they can't take the time off work, and their agency says, I know you got all this K-time, but I got to have you here. We need a solution outside the box for that too.
So we have been flexible with that as well, and I would have to lean upon the agency and their budget, what they can afford. But their counterparts with OJJ right now, the commission has allowed. Of course, non-exempt employees can get time and a half, but the commission has allowed for time and a half payment for non-exempt and exempt employees who are working overtime to stabilize some of their youth facilities. So that is an option if the agency can afford to do that.
And that's the difficult question. Do we have that money in that purse to pay for that kind of stuff? Maybe one of the things to do is do some things we saw in corrections. It worked really well. With some of these folks that came in that didn't maybe. They were smart people and they could learn the processes. They just didn't have the background to know it, and they helped them. They tutored them and helped them through, and helped them with test taking skills and all the things necessary to be able to move up in the ranks. And that was pretty successful. That worked well. So maybe something along those lines to look and see what we can do with this. This isn't going away tomorrow. We're going to continue to have, and a lot of what I've read, because Mr. Chairman, being the chair of labor, this is something that I have to keep up with, and a lot of what I've read says this is going to be a problem that we're going to continue to see at least until 2024. And so we need to do something about this, and we're going to have to get creative about that. So I would urge you to work with these departments as best you can to try to come up with solutions. And look, sometimes when you do that, you're going to create other problems. We understand, but we got a crisis right now, so we need to be a little more flexible and try to deal with this.
And I think your point's very well taken. As we go through the legislative process, we do need to think about our state employees and the pay that they're receiving, because, as you mentioned, it's no longer that attractive when we're trying to recruit someone out of college and we tell them that they have to work till they're 62 years old. They're going to go for the money, the average hire, just for your information, in state government is 35 years old, is our average hire. So we're not getting the best and the brightest because they want something that's portable. They want a retirement that if they leave, they can take some portion of that with them to another employer. And they're looking for a lot of flexibility and benefits that, unfortunately, in government, sometimes we are not able to do because of our mission that we're charged with. So.
Thank you.
Thank you, Senator. So we have different silos of things we're working on, and we identified a lot of the things early with the department. But, from DCFS and from civil service, any of these initiatives that y'all are working on, short-term, long-term, please get it to Ms. Cannon, Ms. Peck. I think we are creating a really good workflow of objectives that we can hit that I think will give the public confidence, as Senator McMath said earlier, that we're protecting families and children. And a lot of times these initiatives and some of the things you're checking off the list, it moves the needle, but so slowly, it's good for us to have those goals. So if you don't mind, let's add that to our list of civil service and the department's short-term, long-term, imaginative goals that we can accomplish.
And Senator, I just want to assure you that from the very beginning, the Commissioner of Administration's office has kept us apprised of the information that's going on. It meets with us on a regular basis. I know we do not attend the meetings with the agency and the governor, but that information is relayed to us from the Commissioner of Administration, and it has been a priority for us.
We sure appreciate your spirit of cooperation, both of you. Senator McMath?
Thank you again, Mr. Chairman. Just real quick, I wanted to add something to, I guess, the to-do list. And Ms. Ricks, you might be able to address this. I don't know if civil services is going to apply to you unless there's some sort of barrier to the question I'm about to ask. But in terms of recruitment, again, coming back to that, are we doing any out-of-state recruiting, or is it just within the confines of Louisiana? If we just would love to gather that information, also something to think about when we're talking about thinking outside the box. Let's also think outside the boundaries of the state as well. And I don't know if civil service, if there's any sort of barriers to hiring from outside of state, not to mention could be a good recruiting tool to to get folks back into Louisiana. And I'm thinking of individuals that are called to serve other countries, right? I mean, we've got a crisis right here at home in our great state, and just something that could be a useful and productive tool.
To McMath, I'm sure that some of the things that we're doing are definitely crossing over, especially on social media. Civil service does some, but our communications office does some as well. However, what I take from your comment is ideas for us to do a little bit more. I think the only conversations we've been having recently has to do with the tax burden. There are some of our positions, for example, we talked earlier about those who take the phone calls and centralized intake. It's an at-home job. So could someone do it and live in Texas or right on the border of Mississippi? Potentially. And I think that what we have to watch for is making sure that those people know that if they're working here but living in there, that there's some tax implications to it. But those are the only conversations we've been having recently, especially trying to figure out, is there a way for us to tap into the market? Dr. Hodnett has had some other ideas about some things that could be done similarly. As we continue to pull those things into our list of actions, we will apprise you of where they're going and how far we're getting with them.
Thank you.
One follow-up specifically for y'all to look at for us is to look and see if there's a possibility of a waiver of a starting pay above midpoint in some of these job classifications, and see if that's something that we could do at least on a temporary basis to try to get us past this shortage. Thank you.
Very good. Just a couple of things, and then we'll turn it over to the public unless you have something else to say. But I know this is kind of crazy, but buy one, get one, BOGO. When you go get some shoes, you get 2 pairs. Do y'all have a kind of referral program that if somebody in the department brings you a really good hire, that person is rewarded from a recruitment effort? Do we have anything like that in place?
That is something that we can certainly explore. We've had some agencies reach out to us, but we've never had one come to the commission. The last time, and I'm speaking just from memory here, I believe we did it during Hurricane Katrina in New Orleans with nurses, that if they referred someone and that individual stayed for a period of time, then that employee would get some type of lump sum payment. So this is definitely something that we can consider.
That's becoming huge in private industry and very successful. I've seen some healthcare areas that when they do bring in that lead, they get a nice little referral bonus, and it has created just a tremendous amount of enthusiasm. So from a department standpoint, this could be a big morale boost to say, bring in somebody as qualified as you, and there's a reward system. So y'all going to look into that?
Absolutely.
There's something certainly we can look at, yes.
Okay, terrific. Any more questions from the committee as far as civil service and that aspect of where we're at? Representative Hughes, you've been very quiet. You welcome to join in. Anything you wanted? Okay. So from that standpoint, why don't we keep everybody still here? Your department can go, but why don't we keep everybody here? Let's hear from the public that wants to speak, and then after that, we'll close it with any final comments or anything that the committee may have. So we have 3 cards that would like to speak. Ms. Brandy Melissa, Dr. Vicki Tolliver August, and Leah Noel. So now would be the time for you to come and address the committee, and we want to thank you for your patience of being here, but now would be the time to join us. Ms. Melissa, nice to see you.
Same to you. I'm Brandy, for y'all that don't know me. Other than Representative Mizell, Senator Mizell, I'm sorry. Representative Hughes, and I know Senator McMath in the previous years have discussed why we've been sitting here for 3 hours. The problems that have been in the media this year are nothing new. A couple of years ago, when the people were in this committee, they said changes were going to happen. We have a 2-year-old dead from his 3rd fentanyl overdose, and more foster kids are being molested by their foster parents, and that's also not a first-time occurrence. in the early 90s, not too long after what you mentioned, Senator Luna, I was removed from school on a Friday afternoon for an allergic reaction to a bug bite. Foster kids are supposed to have their own rooms or own beds. I slept in the living room. The year after, I turned my oldest brother in for molesting me in a house with grown adult men. Nobody said anything. When I filled out my card to talk, people got nervous. I love this current secretary. Even when in 2016, she got in front of a committee and said if the budget was cut, certain calls would get ignored. I wasn't too fond of that. We've been at odds a few times over different stuff because y'all are looking at a non-viable pregnancy because of the domestic violence and late-term pregnancy termination. I have a pretty much non-existent brain and skull right now, and I'm about to be 39 Monday. I just had a wisdom tooth extraction 2 weeks ago. Because of my medical condition, I had to deal with the post-op without pain medication. And I'm sorry, but I don't have the medical record I do with the experience I have. And I can't sit here and be quiet about the stuff that's going on because it literally irks me to my core. The conditions that these kids are being forced to stay in when they come out of trauma. Imagine somebody being sexually abused, going into a foster home where it continues to happen by their foster parent that was supposed to be guided by the state. You know, they got certified and everything else. They passed all of them tests. My first experience with OCS, DCFS, whatever it was back then, you know, showing my age, was being in an emergency room when all that stuff happened when my brother was molesting me. A sheriff's deputy told my mother if she did not find my brother somewhere else to go, I was going in foster care. Year later, I was for non-abuse. It fractured my entire family. My mom died with her 2 oldest children hating her guts. And I'm sorry, but it needs to stop. In these discussions that y'all been having for 3 hours, I hear during the session in appropriations and finance. This is health and welfare. We're here to talk about dead children, kids being killed from fentanyl overdoses, 2 years old. No hospital gives Narcan to a 2-year-old on a daily basis. Those calls were substantiated because that's not normal. We're talking about kids being sexually violated. To this day, I can't handle certain situations because of what I went through as a child. And that happened from my brother being violated by a Bible college student who is currently writing in Rayburn. That y'all probably saw on Channel 2 in April. It's a cycle that's going to continue till change happens from the top to the bottom. And don't just focus on the secretary of the department. Y'all need to focus on the parish where the problems happen. Because there's somebody sitting in this room that nobody's talking about that needs to be looked into, and I'm leaving it at that. Y'all have a good day.
Thank you for your testimony. I did call on a couple other folks. I'm not sure if you're still here, but now would be the time. If anybody from the general public would like to comment, now would be the time. And just state your name, and we welcome you into the committee. Stacy McPherson, I think, has a card. If you would like to speak, we can put 3 people at the table. Anybody else? We can, like I said, we can put 3 people at the table. Wherever you'd like to be.
Right there first.
It's all yours, ma'am. Thank you.
Okay. Thank you, committee, for giving me the opportunity to speak. My name is Dr. Vicki Tolliver August. First and foremost, I know the secretary knows who I am. Dr. Renda Hodnett knows who I am. I am a foster parent, and I'm an educator as well. I hear a lot of talk about educators, and yes, there is a shortage in education, and we have innovative ways for filling those positions, so I do concur with what you stated. My experience with this agency has been an utter nightmare. A nightmare. I've come to the point where I'm considering closing my home. However, I've had numerous people to ask me not to close my home because I've been a staunch advocate for these kids in foster care. When I say that my complaints have been documented, Secretary Walters and Dr. Hodnett knows my complaints have been documented. And because of that, I feel as though I have a target on my back. My experience first started, and let me please go back and say, I do thank you too, because I can tell you this much. Every time I have written a letter to Secretary Walters and Dr. Hodnett, I have gotten responses. Should I have had to escalate it to the top? Not really. Having 5 to 6 managers, one would think it wouldn't have had to get that far. But that is how DCFS works. You have so many people at the top, it's top heavy, that when it gets to the bottom, nothing is getting done. And you're working these people to death when these other 5 to 6 individuals are sitting there sometimes in the confines of their homes, working from home, making these large salaries.
Can you give us, as you talking, can you give us like a real life example?
Yes, okay.
A challenge you had that we could all relate to?
Yes. Well, I don't know if you could relate
Well,
to this.
not relate,
Okay.
but that we could understand.
Okay.
That we could understand.
When I first came into the agency, we were required to provide documentation of everyone that's in the home. And I'm talking about confidential information, birth certificates, Social Security cards, driver's license, immunization records, things of that nature. Well, I did that for every family member. And lo and behold, all of my information vanished. We're talking about confidential information. Social Security numbers, driver's license, all of my documents vanished. I had a right to be upset because I work with children. I do the same thing as child welfare workers, but from an educational perspective. I write reports. I work with families. I evaluate, do diagnostic testing for kids. Some of my reports can be as short as 15 pages. Some of them can be 70 pages. It just depends. And I work as a part of a multidisciplinary team. And most of the time, I am the evaluation coordinator. So when I get this confidential information from these families and doctors and psychologists, it's incumbent upon me to make sure those documents stay confidential. I cannot lose that information. It has to stay under lock and key. So yes, I was very upset that all of my information, and to this day, almost 6 years later, nobody can tell me where it went at all. So when I made a complaint about that, the child welfare worker who I was assigned to, she was upset. And she said some very disparaging words about me, which I didn't know until I get further down in my story, and I can tell you. So to fast forward, this child welfare worker, she did the home study. As a person who's responsible for writing reports, I give copies. All school districts that do, we do, it's called pupil appraisal. We go over the findings with parents. We discuss these findings to make sure if there's anything that's wrong, we fix it. We have a compliance department that rereads our reports to make sure that we don't have Billy listed as Barbara or the date of birth wrong, so we have someone to oversee what we also write. Well, that didn't happen in my case. I continuously asked for a copy of my home study. I was told the agency's policy was that they don't give you copies. I said, okay, well, could I read the home study? You can keep it and we just go over it because I wanted to make sure everything was accurate. They refused. I went all the way up to the top. I didn't get to Secretary Walters or Dr. Hodnett in this case because I got stopped. But that individual told me, well, it's in the state law that we can't, share the home study results with parents. And I found it to be very conflicting because I had a home study completed on behalf of Department of Children and Family Services by the Catholic Community Services for a child-specific adoption. I got a copy of that home study. Which was commissioned by the DCFS. So I'm not sure when the policy changed, don't know. But I kept pursuing getting a copy of the home study, or at least discussing it with someone. Not sure whom became privy to my complaint, but I got a copy of the home study. Someone mailed it to me from inside of DCFS anonymously. I got it. And when I got the home study, I was livid. So some people may be getting approved to be foster parents who may not, in actuality, be qualified to be foster parents because my home study was copied and pasted from somebody else's. It's like a template was used, and they simply took the information from one home study and possibly others, and put the information into my home study. The names of my children were wrong. The dates of birth were wrong. The schools attended were wrong. The ages were wrong. They had me being born in 1976 when my oldest child was born in 1986. So that didn't look too great because that meant I had a child at 10 years of age. So, of course, I was very, very upset. I put it in writing, sent a certified letter. I made a copy. I highlighted all of the errors. That got their attention. Secretary Walters assigned someone to get in touch with me, and that was Miss Karen Washington. I met with her. She apologized for the home study because it was, grammatically speaking, it was horrible. Run-on sentences, sentence fragments, paragraphs just left out. It was like a third grader had written this report. And she apologized. So we got together and she corrected it. Well, in the process of this, that same child welfare worker ended up sending a disparaging email about me. Now, she used that same email thread that I had sent the complaint on, not realizing that I was included on the email. And she was talking about me. And this is what she said, quote, "You all better make sure that you dot your I's and cross your T's when you dealing with this woman. She will hold your feet to the fire." Not realizing I was also a part of that email. And I responded to all, "You are absolutely right." And I made sure she was removed from being my child welfare worker because she had already established this bias. It's not that I was out to get anyone or to antagonize anyone, but I wanted I wanted her to do her job. You fabricated a home study. You put information in there that was incorrect. You didn't care. You got mad when I called you out on it. Then you made me a target in this office. So what they started doing was they wouldn't call me for children. They wouldn't call me at all. They had set up like a bullseye on my back. So at that point, I requested, because I did eventually get some kids who they stated they couldn't find homes for, and they tried this and tried that, and I just happened to know one of the foster parents. So I did get some kids, but I requested at the same time to have my case transferred to the Baton Rouge office until I was told this worker was going to get some sensitivity training and that she was going to retire. So I wanted to go to another region just temporarily until this worker retired. So that is the request that I put in. Eventually, I was told by other foster parents, because I'm in the Thibodeau, supposed to be in the Thibodeau region, I requested to go back because I do something very similar. So I work with a lot of parents in the Baton Rouge area, and it was causing a conflict of interest. So when I was told that the caseworker had retired, I put in a request in writing to be transferred back to my region. I was told by one of these regional directors that it was going to be done. He assured me it was going to be done. My case sat and sat and sat. Then I found out that I didn't even have a home development worker, and nobody had told me. So my case had just been sitting there collecting dust. We were not getting any calls, even though we had availability. I subsequently wrote another email, and that led to a Zoom meeting with this middle level manager and his colleague. They're on the same level, but they run two different regions. So he was over 3 regions, she was over 3 regions. I was told that my case was going to go back to the original place where it was supposed to be, because I have a relationship with these foster parents. I live in this region. So I was assured it was going back to the Thibodeau region. It did not. So once again, I started writing emails. I got in touch with Dr. Hodnett. She and I conversed about this. She said, okay, she was going to put our family back in the Thibodeau region. Well, that didn't manifest because that manager, who I had the Zoom meeting with in the comfort, while she was in the comfort of her home sipping tea or coffee or whatever, she intervened. And her excuse was, oh, we're shorthanded. We're going to put you in the Covington region. So I have a home development worker all the way over in the Slidell area, and I live in Ascension Parish. So I'm not getting it. I wasn't getting any calls, and I'm a part of the Thibodeau region where there's a great need for foster parents. The need is so great that they're going on Facebook saying, do you have openings? Can you please take these kids? But I can't get a call because I'm in this region so far away, and the only way I get that call is if they have to send these requests to other regions. So that's another problem, that they have these regions set up with home development. So my thing is, as some of these workers, some of the actual employees have stated, some of the issues have to do with harassment. It has to do with oversight, too much oversight, and it also have to do with biases. Because this, unfortunately, Dr. Hodnett convinced me to go to this region against my better judgment, and it has been a nightmare for me and my family. That's just one of the issues. Another issue, what I have found, caseworkers do not do their due diligence. When kids are brought into the system, it was, to my understanding, when I became a foster parent, is that the goal of taking these kids in is reunification, if at all possible. They're supposed to seek out a suitable relative. That is not being done at all. It's not being done. So kids are languishing in the system because they're not trying to find relatives. I'm working with a child right now, and that is the case. So I know this to be a fact. Some cases are fast-tracked, meaning that whoever that caseworker is and however she writes that case, they push those kids through for adoption. Sometimes foster parents sabotage that because they want to adopt. And that's the unfortunate thing, because we're certified as foster and we're certified as foster to adopt. But I would never sabotage a child's reunification goal at the expense of my wanting to have that child for myself. And that's an issue. Another issue is breaking up sibling groups when there are homes available in other regions. I just experienced this about 2 months ago. A sibling group came in, it was 4. That sibling group had a family in another region that agreed to take them. This came from the child welfare worker. She said, I found a home for them, but my supervisor would not allow me to place the kids in that home because it was outside of the region. So you know what happened? They split those kids up into 4 separate homes across 2 regions. Even though there was a home that was willing to take all 4 and head the room. So it's these hidden biases like this and these selfish ideas that they have about where children should and should not be. Another issue that I have found, when it comes to children of color, they're quick to call a family that's not a person of color or a family that's of color. But flip it around. If it's a Caucasian child or a child that is not a minority, they're very hesitant to place that child with black families. I know because I was called about 2 weeks ago. And the child that they called me about, which is in the Slidell area, is still not placed. But I think that the worker didn't want to place her with me because I'm African American. I have found it to be an issue. A lot of parents have found it to be, foster parents of color have found it to be an issue. They can say what they want to say, but we know that these are issues. And finally, families that are interested in adoption have been overlooked for a placement and are not considered due to a lack of information of their certification in a statewide database. And I'm bringing this up because families have asked me to bring this up. There's no database at all to verify whether or not a family is certified for adoption and or foster care. They you have to give your caseworker's name to another caseworker who then calls the other region to verify if you are actually certified. And in 2022, with all the technology that we have, there is no reason why there should not be a statewide database. These are my experiences with this agency, and I guarantee you, since I have been very vocal about it, and I'm going on record again stating that I would like to be back in my region where I live so that I can get kids from my region. But these are issues, and unfortunately, Secretary Walters is sweet as she can be. Dr. Renda Hodnett, phenomenal. I even have her personal cell phone number. But it is those people below them, those middle level managers, those regional managers who happen to be over 3 different parish offices or however they want to go. That's where your biggest problem is. That's where your problem is, along with these supervisors that are managers of these parish offices. That's your biggest problem.
Thank you. Your testimony is so insightful, and just so you and the public know, we take in all of that into the minutes. We're going to work on a lot of these issues. There's different agencies that look at different things, like the Legislative Auditor's Office is going to probably take in your testimony. So we want you to know that there's checks and balances. I know you've heard the department's thought process, their vision, but we thank you so much for being out there to take care of our children. And anytime you want to send this committee any information, we're happy to receive it.
Thank you for your time.
And thank you for education for the kids. We do have a question from Senator Fessy.
It's not really a question. I just want to thank you for coming forward, because exactly what you're saying is what I'm hearing, and I'm hearing from a lot of people. And like you said, it's not the secretary or assistant. It's in between, and that's what I was saying about the layers of management. We need to fix it. So I agree with you 100%, because everything you said, I've heard 3 or 4 times, and it's something that we have to get a handle on, and it's devastating these children. But when you told me you separated 4 siblings, that's the worst thing you could do.
Yes, I agree.
So we need to fix it and fix it quick. So thank you so much for your testimony.
You're welcome.
Senator Carter.
Thank you. I just want to also echo the comments from Senator Fessy and thank you for providing your testimony today and your experiences and sharing that with this committee. I certainly have heard, Madam Secretary, as well, allegations about racism, allegations about people not being treated fairly. Is that being investigated as well? I know we're doing a lot in terms of numbers and budgets and making sure that we're recruiting and making sure that people are properly trained. Are we also implementing diversity training and make certain that allegations of racism are addressed and then they're stamped out wherever we find them? I see you nodding, but as we continue this, I just want to make sure that remains part of our focus, is addressing all concerns. Thank you for your testimony.
You're welcome.
I think that there's an ongoing list, so we can either have the
Add that to the
secretary-
list, please.
Right,
Yeah.
right. Thank you, Senator Carter. If you want to.
Hey, good afternoon. I'm Stacy McPherson. I was not prepared to talk today, so I brought nothing. But as a previous DCFS worker myself, not in this Baton Rouge region, it's a different region, in Alexandria, I recently left the end of July, and I'm going to cry and try not to cry, because that was probably the hardest decision I ever made in regards to my career. I've watched these interviews, I've watched these legislative sessions, and about how workers need to care about these kids and these children need to be put first. And I know for 6 years that these children and these families were my life. And when I say my life, it took precedence over my own children. It took precedence over my mother, who was sick and is now deceased, and I can't get any of that time back with my kids or my mother, because I devoted myself to this job 24/7. And Renda Hodnett and Marquita Walters know this. I've emailed them. I have stated on numerous occasions the concerns in the region that I was in, the toxicity in these work environments that gave not just myself but coworkers extreme anxiety, the symptoms of almost PTSD of having to return to these offices the next day or on a Monday. I know the retaliation that I'm going to face from sitting here right now. I know that it's coming. I know what they're thinking as I'm sitting here putting all of this out here, but these are children. These are children that cannot speak for themselves. They can't fight for themselves. It's like the only advocate they have are these workers, the workers that care. I'm not even going to say it's all of them. There's a handful of workers that truly put their heart and soul into what they do in this job every day, every night. I've worked 19 hours a day, numerous days a week, and I don't get time and a half for that. I get off at 4 and I get K time. I had tons of K time when I left because I didn't take off, because I knew the work that was there that had to be done. I knew the work that was going to be there if I left and came back in 3 or 4 days. My children needed me. My foster parents needed me. My families needed me. I really feel like in my heart that I did everything for them that I could do. I have continued. As I sit here today, I am not working. I have not worked since I left DCFS, and I will tell you, I made over $43,000 a year after 6 years of being there. The money is not the issue. The 5 people that left this one office as foster care workers within the last 5 weeks, 5 workers left. 20 years, 5 years, 6 years, 8 years, they've been there. None of it was money. Not one reason for any individual that left. It is the toxicity of the work environment. That's what it is.
Talk a little bit more about the toxicity.
We knew that it was kind of a, I guess, underlying, non-official, you do what you're told to do. You don't go against the system. You don't state your concerns. Because if you do that, you get the retaliation of just the, I just being, everything's going to be your fault. They want you to go with the flow. They want to say, this is what you do, and this is and this is how you do it, and you just do it.
Who's they?
Supervisors, management, directors. It's even been as far up. I mean, I've went to the top. I've went to the top over and over and over, and there's been nothing. I went in 2020 with a host of people and met with Ms. Hodnett and Ms. Walters, numerous just dire concerns that were put in front of them by numerous individuals. That was 2.5 years ago. You know, so for me to sit here as a previous worker and hear that, you know, we've taken care of concerns, they haven't been taken care of. We're in a worse place now when I left in July than we were in 2020. There were concerns that were brought to their attention in 2018, and when I say there, it's supervisors up in 2018. So here we are at the end of 2022, and we're in a worse position than we were in 2018, than we were in 2020. There's nothing that's getting better. It's not even, so to speak, the caseloads. During my 6 years there, I carried almost 30 cases in a foster care caseload while I was helping out with investigations due to backlogs. So I probably had over 30 cases between two programs. I wasn't stressed out. I had a good supervisor. I had a good manager at that time. It was during the 6 years of my lowest caseload that I got put on medication, that I was in and out of a doctor, because I felt like I had the target on my back, so to speak, because I spoke up and I stated my concerns and I fought for my kids. And fighting for my kids, I've had cases taken away from me that I had for probably 2 years because I was too attached, and that was the exact words that I was told by a manager, that I'm too attached. 3 very, very small children that I was the only consistency in 2 years that those children had were given to a whole nother parish and region because I was too attached to these children.
So in the 5 workers that basically had a high-level meeting, what were the main talking points that were brought out that would help the committee to understand the plight of some of the workers in a toxic work environment?
It was discussed that there were workers that we weren't allowed to go in other workers' offices or communicate with other workers. The division is extremely rough, where workers were hiding under co-workers' desk because a supervisor or manager would come in, so they would have to hide because there would be retaliation for that. You would get in trouble for that, for communicating at all. There was a fatality that was addressed during that meeting in great detail of how that child passed away, an infant. There were foster parents who talked about kind of the same things that she's discussed, that you know, we have to provide all of this stuff to DCFS to be able to take care of a child. You know, they're willing and they're able and they want to love on these kids, and foster parents leave when their good worker walks out the door. You know, sometimes they won't take cases unless they know who the caseworker is, because they know who the good workers are and who's not. You know, I've had foster parents who have closed their homes because they're kind of dealing with the same things that she has of, they speak up for the children and they try to advocate and fight for them, and they're retaliated against. So kids don't get put in their home and they don't get phone calls. And it seems like the more all of these meetings come out, the more it's across the whole state of Louisiana. I can only speak for the 2 parishes that I worked in, but it was the same exact circumstances, the same exact environment that led me to put in a 2-week notice and walk out the door. And I was told in the midst of my 2 weeks that I was to have no contact with my children, no contact with my foster parents, and no contact with my biological parents at all. At that time, I was still an employee at DCFS. My teenagers that I've been their only stability for 2 years were told they're not allowed to talk to me. They can't call me. I can't talk to them. No communication has been done with me or any of my foster children that I had while I was there. All of these children I had for a year and a half or more. And that, you know, if we're going to talk about what's in the best interest of our foster children, then let's talk about what's in their best interest. We're pulling their stability. We're pulling the ones that love them and care about them when their parents are not in the capacity to be able to do that. But we can't go in an office and talk about the fun things we did with our foster child or how much we care about this child, because we risk that whole case being pulled away from us. So we just kind of sit in our office and we do our work, and we just hope to make it through that one day, because every day is excruciating. It's toxic. It's extremely toxic, and I don't know any other words to say for that.
Well, we appreciate you coming here, and Dr. Tolliver kind of left us with some to-dos to look at, and you left us also we have some questions from the committee members. But as you conclude, kind of my questioning with you is, any advice you would tell us to dig a little deeper, do a little bit more research, do some things, because any action plans you would give us from your years of experience and your colleagues who left?
I think that any worker in any given DCFS office needs to be talked to individually. There's a lot of workers, and you know, I kind of feel like, because I'm not there, that I have to speak for my coworkers that I left behind that are struggling, that they're trying to do their job, they're trying to just hold on with that last little string before they walk out the door, because it's coming. There's other workers that are just a hair away from going out the door. And it's not because of money. It's because of supervisors and management and directors, and they feel like they're not being listened to. They feel like they're not important, that it's documentation, and it's doing everything but what's in the best interest of a child. So they're scared to talk, but that would be my suggestion, is that somebody outside of from the top to the bottom needs to go, because they're very untrusting. It's hard to sit here. I've been where they are. I've been in that position where I wanted so bad to just scream that this is what's going on, but you can't do it because you're risking your career in doing that.
Well, we appreciate it, and it was a pleasure for us to visit you. Senator McMath.
Thank you, Mr. Chairman. Ms. McPherson, excuse me. I really appreciate your testimony today. It's helpful to hear from. I mean, I think you might be the first recently employed, caseworker that has come and given input, and I've found it to be very valuable. I have a dear friend of mine who is a constituent who was in your position for many, many years, and she has given me stories, and it's very consistent with your experience, and that is, it's not necessarily about the money or the workload. It was the support or lack of support that she was not getting from management. She walks dogs now. And while she finds it to be much less stressful than the job that she held at DCFS, it's not nearly as rewarding. And she said if it ever changes, she would seriously consider going back, but she still keeps in touch. And so I've gotten some input from her, and it's, again, very similar to what you're saying. And Doctor, I appreciate your testimony as well. There seems to be a theme of retaliation that we have heard consistently when we're discussing foster care, or the experiences that you've had, that's something that's very I don't know, it irks me. I hope that's not the case. Where there's smoke, there's fire, and we've just heard it from so many different individuals that I find it unfortunate, but yet probably accurate. Is it your opinion that the two children that were transferred because of your alleged or supposed attachment to them, do you believe that was based off of, that was some sort of retaliatory action? Or
I do.
Can you speak to that case a little bit? I was trying to follow you, but
I do. They've been adopted, but I don't want to give specifics.
And don't, please, obviously, don't reveal anything you can't.
They were very young, 6, 7, and under, 3 of them.
Mm-hmm.
And parents incarcerated, so they have no contact with them, no other family members. So they were in a foster home, but due to the severity of how, with 2 of those children, some of the reasons that they were in foster care, I had to spend a lot of time with them, with doctor's appointments and different things. And so you just kind of get a bond with these kids, especially when you know that they don't have anybody else. They don't have family visits. They don't have visits with the parents or grandparents or anything like that. So it was the foster parent and it was me. And I was their go-to for, when they had a bad day, when they, made the baseball team or the softball team or, anything. I was just kind of second mom is the way they said it. So when all of that's just pulled from them and you're not able to say, this is why I can't talk to you anymore at an age like that, that's another trauma for these children. That's another sense of abandonment on these children. And our policy says that, we are to encourage and support any positive attachments that these children have whenever they're in foster care. I don't know why a caseworker is exempt from that, because some of these kids are in care for 3+ years, and that is a positive person for them, to reach out to. Even if they don't go back home to their biological parents, that's still a connection that they had during this foster care journey for them, and they're just taken from them. Mm-hmm. And I did have another case, an actual human trafficking case, where I was kind of threatened on that one being taken from me because of my attachment with this child that was like 12. For more than 2 years, I had that case before I left. And that child was devastated that I couldn't call her anymore and that she couldn't call me. There is no other attachments for her. And
that's the no contact order that came after your 2 weeks. Was that part of, that's
during the 2 weeks, that one.
Is there could you think of any logical reason as to why you were told to, after you've given your 2 weeks, to not have any contact?
I don't know.
Outside of
there were 2 other workers that left the 2 weeks prior to me. We've talked, and they never were told not to contact their people. The kids, the parents, the biological parents. I had numerous biological parents texting me, and I couldn't, on my personal phone, and I couldn't even respond, because I feared if I even reach out and say, I can't talk to you, this is what I've been told, that I was going to be the one in trouble for doing that. So I had to just leave it, and not respond. But out of the 3 workers that left around the time that I did, I was the only one that was instructed to not do that.
Well, listen, Ms. McPherson and Dr. Thank both of you. I think for the folks that are watching at home, and whether they're current or former DCF employees or foster parents, you're giving those folks some courage to possibly speak up. And this is in no way, again, in an attempt to remove, replace, discredit agency heads or the department as a whole. These discussions, I think, are helpful in terms of making DCFS better for the kids that they serve. So thank you for giving those folks the courage to testify.
Thank you.
Thank you.
Very well said. One quick question, and then we'll turn over to the next panelist. The 5 people that had the exit meeting, and if you're comfortable saying this, or if you're not comfortable with this answer, how were the 5 of you guys collectively on a year-to-year basis when you were evaluated by your supervisor? Was it to the standpoint where you received your annual merit raise? Did you get satisfactory evaluations as a group? Was this a group that had problems? Tell us about, if we looked at the personnel files of these people, what would we see?
I know that all of my evaluations that I've looked at since I left, they were all satisfactory. And there's, I have numerous emails that I printed and kept before I left of, the I guess, extent of documentation and how clear it was and how much was in there. I don't feel like I was one of those workers that just got by. I didn't just show up to say that I had a job. That was where my heart was before I even got there.
Yeah.
The workers that left around the time that I did were the same way. There was never concerns. There was never write-ups. There was never issues. They were very hard workers that left. And I think most recent, this past Friday, there was another worker that left, just walked out. And to my knowledge, even working with her, there was never complaints about her. And that's the ones that are leaving.
Understood. Thank you so much. Yes, ma'am. Please just state your name and we welcome your testimony.
Yes, sir. My name is Leah Newell, and I'd like you to have a parent's point of view of DCFS, because I hear a lot of things that are great to make DCFS better, but I very rarely hear about DCFS caseworkers actually working with parents to make things better. Over the last 3 years, the Department of Children and Family Services has ripped apart my family. On May 6, 2019, I was in a terrible car accident after a Natchitoches City work truck pulled out in front of me. By the grace of God only, my 2 younger children, who were 2 and 1, were completely unharmed. However, I suffered from a fractured sternum, torn ligaments and muscle in my right knee, a 3rd-degree burn across my waist from my lap belt. I also had an internal injury that caused early labor at 7 months and resulted in an emergency C-section. This car accident is what prompted my first DCFS investigation, although my children were not taken away until more than a month later. Several months after this, I kept discovering new things about this initial investigation, which actually gave me answers to my case. My mother-in-law and my sister-in-law had told a hospital social worker in the ER that I had caused the accident because I had a drug addiction. This hospital social worker was a client of my mother-in-law's. When this social worker spoke to me, however, she lied and told me she was a nurse. Although I did give her a urinalysis, I was told it was to check on my unborn child's health. She made claims, however, that she drug tested this urinalysis and that I failed for amphetamines. It took 3 years before I uncovered the truth. She never gave me a drug test. Regardless, DCFS assigned an investigator to our family who harassed us relentlessly and lied multiple times so she could keep control over the investigation. This investigator originally told me after my release that the state had automatically taken custody away of my children because I was a danger to them. She used manipulation tactics to force us to take several drug tests, which all came back negative. Law enforcement was used to intimidate and threaten us. The fear of never seeing our children again was used to force us to comply. And the moment we pushed back and tried to stand up for ourselves, DCFS obtained a court order over the phone. Despite the accusations of drug usage, the reason for removal was lack of adequate supervision for only the 2 older children. But DCFS removed all 3 of my children. My husband and I backed down. We complied with DCFS, and in December 2019, a judge signed a vacate order allowing our children to come back home. However, in June 2020, that same judge removed our children a second time despite having favorable reports to close our case from a foster care caseworker, her supervisor, and our CASA advocate that was sent to the judge 4 days prior. The judge then moved our DCFS case to Sabine Parish, but kept the court proceedings in Natchitoches Parish. The Sabine Parish DCFS assigned us a case plan which was nearly impossible to complete. Among many expectations, the most difficult was that we were expected to attend 3 different classes multiple times a week that were spread out in Shreveport, Manny, and Natchitoches, all while keeping steady employment. Our Sabine Parish caseworker attempted to deny the original liberal visitation plan the judge had granted us and gave instructions to the foster parents to deny my husband and me visits and phone calls. When we were finally granted the court-ordered visits, she would change dates without informing us. The reports that she presented to the court contained hearsay and several outright lies. She refused to keep communication between us, and even with proof that she ignored phone calls and emails, her supervisor told us there was nothing we could do about it. She was absolutely malicious in denying us our constitutional right to preserve our family integrity. During a permanency hearing on May 19, 2021, this Sabine Parish DCFS caseworker admitted on the witness stand there was no justifiable cause to initiate an investigation, and there was no evidence to substantiate the removal order from June 2020. But despite this testimony from this caseworker, on July 30th, 2021, without a trial being held, the Natchitoches.
Take your time. Take your time.
The Natchitoches Parish 10th Judicial Court granted guardianship to the children's paternal grandparents who served as the foster parents throughout our entire case. This judge declared in the visitation order, which was granted in October of 2021, this case is now and will always be a parental visitation only case until the subject children reach majority. Despite the fact that my husband and I were never accused or even charged with any crimes of abuse or neglect, despite 3 years of court-ordered drug testing, which all came back negative, which included hair, saliva, and urine, to the point that I had bald spots for years. Despite multiple courses of parenting, anger management, and substance abuse education, despite multiple invasive mental health and psychological evaluations, despite paying court-ordered child support while still sending groceries and anything else our children wanted every month, despite evidence and witness testimony that we were good and loving parents, despite doing everything that Natchitoches and Sabine Parish DCFS and the 10th Judicial Court asked us to do, it never seemed to matter. My husband and I were never given a chance to tell our side of the story, but I don't think anyone would have listened anyway. Because when people hear about one failed drug test, they never want to hear anything else. You're just guilty. The preamble of the Louisiana Children's Code states, the people of Louisiana recognize the family as the most fundamental unit of human society, and that preserving family is essential to a free society. But yet, Louisiana DCFS's behavior and actions did not reflect this in my case. Parents deserve the right to family integrity. Removal of a child should always be a last option because children deserve their parents, and parents deserve their children. If we want to reform DCFS, parental rights needs to be at the forefront. DCFS should focus on not just children, but the entire family unit. Because as I heard today, it really does take a village. It's my favorite saying. It takes a village. Safeguarding the family unit can only strengthen Louisiana and provide a better tomorrow. And we can only be stronger together if we actually work together.
Thank you very much for your courage to come and testify and coming all the way from Natchitoches. We appreciate that. There's one other late card I just received from Susan East Nelson with the Louisiana Partnership for Children and Families. She'd like to testify. Now would be that time. Thank you all again for coming from far. Thank you.
Good afternoon, Mr. Chairman. I'm Susan East Nelson. I'm the Executive Director of the Louisiana Partnership for Children and Families. We've heard some very heartbreaking things today, and I'm not at all going to deny that this is a very difficult situation. But I will say that our organization met with Secretary Walters about 2 weeks ago with a list of suggestions that we had for her, and she's already implemented several of those suggestions. We were the ones that connected her with the EAP program. We've offered our support to this organization as well. it really does take a village. And I want to tell everyone here that the village has gathered around this agency, and the agency has been receptive to a lot of their changes. I will say one of the things that has routinely come up, certainly from the family and from the DCFS worker here, that we've talked about with our friends in the social work community, is implementing reflective supervision. Now, I know that would take some additional resources for the agency to do that, but I think if they did that, they could really address a lot of these issues, dealing with the staff and dealing with some of the issues with the parents and the families. But I will say, I just wanted to go on the record and say that we've offered support to the secretary. She has received that support, and I just wanted to make sure that was known.
Very good. Could you tell us maybe one or two of the key suggestions that you think will move the needle a little bit?
I think one that we certainly recommended the adoption of the EAP program through one of our member organizations, Family and Youth Counseling in Lake Charles. He has offered that support, and that they're working on that contract. We had talked about how to work through the civil service issues, maybe combining some of these positions so that you could offer additional monies, and that's been part of the conversation with the agency, with the Division of Administration. So those are two of the ones that we did very quickly. We talked about using CASA volunteers for some of the supervised visits. We had Kathleen Ritchie from the State CASA Association with us in that meeting, and she was like, how can we step in and help? And again, all of those suggestions have been received by the agency.
Very, very good. The board is clear. We've heard all of the public testimony. We've heard from the department. If the first panel wants to come up for any closing comments, now would be the time, but the board is clear. So maybe any kind of closing comments, and just as you approach the table for the public that's listening, and for anybody that is covering this issue, we're going to continue to work closely with the department. We'll continue as a committee and as legislators to look on how we can all work together. From today's meeting, we got a lot out of the standpoint. We understood a little bit more about civil service. We understood about best states practices. We understand a lot of what's going on as far as attrition rates and what's going on there. So we'll take this and we'll continue to meet. So I want the public to know that this wasn't just a one time and we leave. We'll continue to work together. And I have to say the department contacts the committee members many times. Here's what we're working on. Here's some issues. So this is not our first time to all communicate, but at this level, we'll continue it. So, Madam Secretary, if you and your staff want any parting comments, now would be the time.
Thank you. I would like to thank the four women that came to the table and made statements. I know that took a lot of courage, and I appreciate them coming. It's hard to hear what they said, and you can know that we'll be checking all that out when we get back to the office, and just really appreciate that. I appreciate you as a committee. This is hard. There's no two ways about it. It's hard when we start preparing and trying to figure out how to condense and say things tightly and cleanly so that you can understand this massive system that is child welfare. I appreciate your diligence. I appreciate all the reading that you did and all the material that you have and the studying that you have done to try to understand us better. And we just look forward to working more closely with you. As the Oversight Committee, we appreciate your role in our work, and we will be faithful to answer every question that you send to us.
Thank you. Representative Hughes, I think you wanted the floor.
Thank you, Mr. Chairman. I'll be very quick. First of all, again, I just want to sincerely thank you for allowing me to be a part of this oversight hearing today, and really want to thank the members of the Senate for their very thoughtful questions. Madam Secretary, I do just want to put on the record, despite my feelings about a change in direction, I just want you to know sincerely, so long as you're in your position and I'm in mine, I'm here to be a partner, and I'm here to work with you. Deputy Secretary Ricks, but as we go through that journey, Deputy Secretary Ricks stated, quote, We heard the morale was low in 2016, and here we are 6 years later, and it's still pretty low. And so we really have to dig a little deeper. We can talk about caseloads, but the many emails, the many phone calls that I get, I know you guys continue to hear it as well. It's not, the morale is not just about caseload. And I'm not going to let off on that because we're talking about human capital. These are people that are not being treated well. I often talk about the culture of fear and retaliation. That's something that still exists, and we have to dig deeper and ask ourselves why. You know, Madam Secretary, I know you take the work home with you at night. I know it weighs on you. But these rank and file employees, they take it home with them too. You know, and we have some people in positions of authority that have been rude and mean and cruel, and it hurts. And, you know, I don't know what we can do about that legislatively. That has to trickle down from the top. That culture has got to change. Because there are people who love this work, as hard as it is. They love it. They love children. They love families. And so, as I said in the Appropriations Committee many months ago, let's not make it even harder, you know, with the politics and the culture of fear and the culture of retaliation. So I appreciate that there will be additional hearings, and just know we're all here to help. And, you know, I'm hopeful that brighter days are ahead. Thank you, Mr. Chairman.
Thank you.
Thank you. And just in conclusion, Senator Fessy, thanks for joining us. I know you've put in a lot of work in there. The committee members to take time. And I did want to note that Senator Pope did have a pressing engagement at 1 o'clock, I think, in Hammond, the Hammond area. So he did apologize, but he's going to look at it. And I do want to thank our Senate staff. You did a lot of work, and you've done a lot of research. And I can tell everyone in the audience and everybody listening that many times when there's an oversight hearing, it opens up more dialogue. So I think committee members are going to probably get emails and calls from either foster parents or adoptive parents, or they'll get calls from workers. We'll keep the lines of communication open. I think a lot of that's going to take place. I think there's going to be a lot of coverage of this. And a lot of times when the light is shined, it brings out more dialogue. So I want to thank everybody for being here. Ms. Peck, Ms. Cannon, Madam Secretary, thank you all for the work you all did. And we'll, unless there's a objection, motion by Senator Luno to adjourn, meeting has been adjourned. Thank you.
Thank you.